program.
Yeah.
Not all residencies have physiatry. Is that correct? There's select few, I think.
There's select few, but I think most do.
Okay.
But they'll have like 2 spots, or like
Right.
Dell, for example, have 1.
Yeah.
U of T has 4.
What are you interested in doing in that realm if you were to do physiatry? Is it sports medicine or like rehab medicine? What is kind of the main?
I'm undecided for now. Like I really do like stroke rehab or like spinal cord injury.
Yep.
Sports as well. So like I just want to keep it open.
Yeah.
But I think I really did like neuro and MSK, and then I like slower kind of paced environments.
Yes.
So I thought like it was most fitting for what I wanted.
You know, it's crazy because like once you get into med school, you think like you've kind of you know what, made it, and then that kind of lasts for a couple of weeks, and you're like, oh, I got to make more decisions. Yeah.
100%.
But even within each.
ያ መሰለህ
ልጃቸው
ድምፅ ተመልኩበት አሁን ይሄንን
እየነዳ ነው 17 ነው መቼ ፌብሩዋሪ ላይ oh my goodness crazy
I know
wow okay
ፈጣን ነው እንደና
ቀስ ነው የሚለው ፈጠን ማለት አለበት ታዲያስ አይ ዮሐንስ እኛም ሞላሰስ ሆነን አልገባኝም ነበር
ጀምር
okay let's do it oh. Okay. Guys, our apologies. I know you're not going to be the cause of the tardiness at this point, but I know a couple of you have to leave. So is it Musana that has to leave? Okay, so we'll start with the stroke. If you guys are okay, like hypertension. Okay, fantastic. You guys want to come over? Awesome. We'll get started. ሁለቱ አንደኛው እንትን አይ ነው ደህና ይመስላል
አንድ ሁለት
Yeah, he's sitting a little bit. It's on, eh? Sure. We're medical students are coming in.
Nada? አለቃ
ታቦታችሁን እንደምታውቁ
ይሰማል?
እሺ ልጀምር ስለሆነ እባካችሁን ቦታዎቻችሁን ያዙ።
we're just about to start. If everyone can have a seat,
Yeah, no,
that would be
no,
fantastic. I know people will be
no,
slowly filtering in. But whoever's in, just find a spot, comfortable spot. We're gonna start in the next 2 minutes. What's up?
Remember last time how no one would sit down?
Well, you know, there were a lot of people, right? Partly that's why. ፊት ለፊት ይሆንላቸዋል። እነሱ እንዲያመቻች የፈለጉበት መቀመጥ ይችላሉ። የሚናገሩት ስንት ናቸው? 1 8 9 ነው። ኦኬ ሶ ማየት አለባቸው። እነዚህ ናቸው ተተኪዎች። ስማ ይኸውልህ እንግዲህ ጨረስኩኝ ስትል ደግሞ ጉዞ አለ፣ ሙቭ አለ። ኦኬ ያ
ብርሃኑ ትሰማለህ እንዴ?
I'm sure ይሰማል። ክላሲክ አላስገባለሁ ብሏል።
ባርጉ ሰማቸዋለሁ።
Hi, come on in. Find a spot. እንዴት ነው? ባትሪ ያለቀ? ደህና ነው። maybe አረኩት። Okay, guys, welcome to our community health and wellness fair, brought to you by EthioCan Bridge the Gap and in partnership with Taibu Community Health Center. I see a lot of familiar faces. Welcome to those that are new. Welcome to this space. Essentially, that's what we like to think of EthioCan as a space where we can get together and say hello to each other, have coffee, a little bit of itan, some good food, and open up a space where we can talk about things that impact each and every one of us. So today, I want to give you a big picture. It's a big day. Sorry, we're starting a little late. We just wanted to make sure we had enough people to get started. It always happens that we start late, unfortunately, but the attendance is always phenomenal. You guys have, if you've been here, you see lots of engagement, lots of people come in, and feedback is always great. So 2 parts to, as you can see in the agenda, 2 parts to the day. We'll have the first half of the day, which is really focused on screening programs, and this is the part where Taibu has partnered with EthioCan to get the message out. How do we maintain our health? How do we participate in the health promotion aspect of healthcare? Meaning, you feel well, what can you do to stay well instead of going to the doctor when you're sick, right? So we have screening programs, a room in the back set up by Taibu. Go get your blood pressure checked, and you pick up things that you didn't realize sometimes. They have information on cancer screening, and if you have a family physician, how do you ask for it? And obviously, very lucky to have medical students from the University of Toronto, part of our community. This community of medical students is growing and absolutely phenomenal to see. Like, to me, I'm bursting with joy to see these future colleagues, I should say. I'm a surgeon myself, but I can see how bright and talented they are, and to see them contributing to the community in this way is absolutely sensational. They'll be giving the talk on blood pressure, diabetes, stroke prevention, cancer care, and cancer screening as well. So that's going to be the first half of the day. And the second half will be really focused on our mandate as EthioCan, which is health promotion, mental health promotion. And there's a feature film that we'll screen called Endurance. Some of you may have seen it already. And a panel discussion followed after that. And really, this is, when we talk about mental health, we always say at EthioCan, it is everyone's business. Every one of us gets impacted by mental health, and really it's up to us to own it and say, how do we thrive as a group, right? So it would be fantastic to see. Without further ado, I'm gonna pass it on to Dr. Johannes, who's part of the steering committee at EthioCan, and he'll do the introductions, and then we'll get going as well.
እሺ እንኳን ደህና መጣችሁ። ጥሪያችንን አክብራችሁ ስለመጣችሁ በጣም ደስ ይለናል እና ስለመጣችሁ ደግሞ በጣም እናመሰግናለን። እንኳን ደህና መጣችሁ። እንግዲህ ዛሬ በህብረተሰብ ተገናኝተን በየዓመቱ የምናደርገው ይሄንን የማህበረሰብ ጤናና በጎነት አውደ ትርዕይት ነው የምንለው ፌር፣ እሱን እናካሂዳለን እና ይሄ የዛሬው ዝግጅታችን እንግዲህ የሚካሄደው ከታይቡ የጤና ማዕከል ጋር በመተባበር ነው እና የዕለቱ የዚህ ዝግጅታችን መፈክር ታሞ ከመማቀቅ አስቀድሞ መጠንቀቅ የሚል ነው እና ጠብታ መከላከል ጤናችንን መከላከል ከሸክም ሕክምና የበለጠ ያሰማል ይባላል እና ቅድመ ምርመራ በማድረግ ጤናችንን መጠበቅና መከላከል አስፈላጊ ነው እና እንግዲህ እንደ ህብረተሰብ አንድ ላይ ሆነን ስለ ጤናችን ስንነጋገር ትልቅ ጥንካሬ ነው። አብረን ጤናችንን መጠበቅ በአእምሮና በአካል ደግሞ መደጋገፍ እንደ ህብረተሰብ አስፈላጊ ነው እና የኢትዮካን ብሪጅ ዋናው መሰረቱ ዓላማው ይሄ ነው እና በመቀራረብ አብረን በመሆን ብቸኝነትን ማራቅ እና መገለልን ማራቅ የሚቻል ማራቅ እና አብረን መሆን በሚለው ላይ ነው እና ትልቁ ነገር ይሄ ነው። ዛሬ እንግዲህ ዋናው ነገር ብዙውን ነገር የሚያቀርቡልን ትምህርቱን ወጣቶች ሐኪሞች ከኛው መሀል የወጡ ናቸው እና ከልጆቻችን መማር ራሱ በጣም ትልቅ ነገር ነው እና እባካችሁ ለእነዚህ ወጣቶች አንድ ጊዜ ድጋፋችሁን ሳታሳዩ በጣም ይለኛል። በጣም እናመሰግናቸዋለን እና እንግዲህ አሁን ብዙ ነገር ሳናበዛ አብዛኛውን ቃል ብሎታል። አማርኛ ስለሚያስፈልጋል መሰለኝ ስለነበረው ገብቷቸዋል እና ወደ ዝግጅታችን እንገባለን ማለት ነው። አመሰግናለሁ።
And just to add on what we've said already, part of the event today is to engage everyone in a survey. There's a community mental health research that's happening. Like anything, if we're engaged in a community initiative, creating an organization, it's important to know, is it having the intended effect? I'm just going to move this forward. So we do have among us people that do epidemiology and research and people that really are trained to look at any activity and say, okay, is this heading in the right direction? What does our community need? What do we need? And it's really when we inform ourselves and say, yeah, these are the things that we need, that we can ask for more, right? So if we're looking at funding from the government or support from organizations like Taibu and others that we can partner with, it really is helpful for the community to participate in these types of surveys. It's 100% anonymous. You don't have to give your name. It's just answering questions of what you think is important in our community. What is missing? What can we improve upon, right? So you're gonna have a QR code throughout. You can just scan it. We hope you can do it today. Take a picture, give it to anyone that would be willing to complete it as well. The more participation we have, the better the outcome is, basically. We look at it and say, okay, this is what our community needs, instead of assuming things, right? So that's a good way to do it. I don't want to obviously skip this part. There will be times when you just don't want to be in a big group and you just want to step away, have a quiet space. You can go upstairs, just one floor up. There's going to be a massage, it's free. There's going to be quiet space if you just want to go with a friend or just reflect on your own. So we're thankful for the group that has put this together for us the past couple of years. Now, before we go with the presentations, we have Layla and Eden that will do the land acknowledgement for us. Come on up, guys.
Good afternoon, everyone, and thank you for being here today. We would like to begin by acknowledging that we are gathered at CSI in Spadina, Toronto, on the traditional territory of many nations.
The land is the ancestral home of the Anishinaabe, the Haudenosaunee, and the Huron-Wendat peoples, and is now home to many diverse First Nation, Inuit, and Métis communities.
Toronto is covered by Treaty 13 and the Williams Treaties, and we recognize the Mississaugas of the First Credit Nation for their enduring presence, stewardship, and care for this land.
As we gather here today, we do so with gratitude and respect. We acknowledge the past, reflect on our responsibilities in the present, and commit to learning, listening, and contributing to a meaningful reconciliation. Thank you.
Thank you, guys. Oh, it's important. I'm going to skip over. We're just going to change our order a little bit. We're going to start with the talk on stroke and heart disease. And then we'll go back to this. Very good. So I'm going to invite Musana and Hannah, our extraordinary medical students from the University of Toronto, to take it over. Yeah.
Hi everyone, we're super happy to be here.
So here, you can put it here if you want. And then just press down. You guys want a timer? Yeah, Andrea. Yeah.
Hello everyone, and good afternoon. My name is Maሕበረሠብ.
I'm Musana.
And we're both medical students from the University of Toronto. I'm in my third year, Musana's in her fourth year. And today we're just going to be speaking about stroke and heart attack, things to watch out for, how to prevent it, and go from there. So first I'm going to give a little bit of an introduction on what is the two conditions that we're talking about. So stroke is when a part of the blood flow to the brain is either blocked or a blood vessel bursts, causing the brain cells to be damaged. And also for heart attack, it's kind of the same thing, where there's a stopping of the blood flow, but this is blocked to the heart. And so your heart won't be able to have oxygen to it, causing damage to the muscle cells there. Also, just a heads up, we have put Amaranya on the slides for all of the presentations today, so that if any of you guys find it helpful to follow along, you can also read. So why are stroke and heart attack relevant? So firstly, it predominantly does affect people of racialized communities, so Black and other people of color. And there are certain things that put us at higher risk. For example, high blood pressure, diabetes, stress is a big thing that can cause these conditions, as well as some cultural connections like diet and lifestyle that we'll talk about. So what are the risk factors? What are things that put you at higher risk for stroke and heart attack? We can divide it up into two different categories. There's non-modifiable, so things that you cannot change, and then there's things that you have the power to change and make your life better with. So for non-modifiable, age is the first thing. So the older you are, the more risk you have of developing these conditions. Family history, so if someone in your family has had a stroke or had a heart attack, you are more likely to have one yourself, as well as ethnicity, like I talked about, people from minority communities. What about the modifiable things? What can you change to have better health? So you can manage your blood pressure. We actually do have a talk that's going to be coming after us, talking about ways that you can prevent this. Diabetes, smoking and alcohol is a big risk factor that you can definitely cut down on. Low physical activity. So the Canadian guidelines actually tell us to have 150 minutes per week, which is about 30 minutes for 5 days a week. That can lower your risk for these conditions. As well as diet. So all the trauma, all these things, they're going to increase your risk of having a stroke or a heart attack. So what are the signs? What can we watch out for, and when do we know to call 911 and get to the hospital quickly? We can remember it with the acronym B, FAST. So B is going to be balance. So people who are currently having a stroke are going to be off balance, wobbling in their steps, and it's going to be abnormal from what they usually are moving. Their eyes. So they'll have double vision, they'll feel like the room is spinning, things will be blurry. And you can also ask, like, can you see me? How many fingers am I holding up? If they're starting to notice that things are looking weird for them. F is going to be face. So with stroke, a lot of the times, half of your body will start showing symptoms. So half of the face will start drooping, which actually goes into S for speech, which I'll talk about later. A is for arms. So a quick test is you'll start feeling really weak in half of your body. So you can ask someone, can you raise both arms? And if only one is going up and they're noticing weakness on only half of their side, you know that this is most likely a stroke that's happening. S is going to be for speech. So they're going to speak slurred, their words aren't going to be making any sense, and this is all going to be at the same time as the face drooping and the blurry vision. And then lastly, time to call 911 is going to be T. So if you're noticing all of these things, please do not hesitate to go to the hospital. We've actually heard of stories of people kind of putting off these symptoms, saying it's no big deal, I just feel a little bit off, and actually have driven themselves to the hospital while having a stroke. So a lot of the times we talk about in medicine that time is brain. The longer time you wait, the more of your brain is dying because it's not getting enough oxygen or a blood vessel has burst. So really watch out for these symptoms and don't be afraid to go, because it's always better to go to the hospital and get cleared than to go and have lifelong implications. So what are the impacts of stroke? What happens after you've had it? Some people get to the hospital on time, get the medications they need, and recover without deficits. But a lot of the times, unfortunately, there are lifelong kind of consequences that happen after your brain gets injured in this way. So kind of like the symptoms that we talked about earlier as initial signs, these can persist after a stroke. You can have problems with your vision, so lifelong blurry vision, difficulty speaking or understanding when people are speaking to you. Swallowing can also be affected, so you might have difficulty swallowing foods after this. Also, weakness can persist after having a stroke, so a lot of people after having this aren't able to be as strong as they are in half of their body as they used to be. Balance is also another thing that's going to be implicated here, and then also muscle stiffness. So you might be stuck in a position and it might be really hard to get out of that because once again half of your body has been damaged because of the brain injury. So unfortunately for stroke, there aren't many screening guidelines that prevent people from getting it. We have all the risk factors that we talked about that you should watch out for and try to modify, but these guidelines are more so for people who have existing heart conditions. If any of you guys have heard of atrial fibrillation, it's essentially an irregular heart rhythm, but these people have guidelines that family doctors can screen to kind of put them on medication so that they can prevent having a stroke. Okay, so now we'll kind of wrap up the stroke section of our presentation. So if anyone from the audience can answer this one question, what's one sign of a stroke that you will remember? Yes. Yeah, Mama. Oh, she critical now. Thank you.
Okay, so we're going to switch gears and talk about heart attack and signs and symptoms. Yeah, so as Hannah mentioned, heart attack is like a similar
process that's happening, like it's a lack of oxygen because there's a clot, there's an obstruction, and then you get, in this case, heart muscle damage. So just wanted to highlight some signs and symptoms, some of which you guys might have already heard of. So the first one is crushing, pressure, tight sensation in the chest, typically is more in line with a heart attack or an MI. Radiating pain to the left shoulder is also something that people commonly experience. You can also feel like numbness or tingling in your fingers. And then also for women, there are like non-common signs, and so that's back pain. And oftentimes it can get missed because it's not that classic like chest crushing pain, and so stay alert to that as well. Sweating as well, and then shortness of breath, so feeling the need to catch your breath. That's especially worse with like walking and like movement as opposed to at rest. Okay, so for thanks. Okay, so for screening guidelines, so there's the Framingham Risk Score, and many family doctors will calculate this for you, whether you're aware of it or not. And essentially what it does is it takes in multiple things. So your cholesterol levels, your blood work, your age, if you have high blood pressure, etc. And it gives you a score, and it tells you your risk of having a cardiovascular event. So that could include a heart attack in 10 years' time. And so this is a nice, objective way to track your progress. And next time you go to your family doctor, maybe you can bring it up to them, and they can pull up the chart with you as well, and you guys can talk about how you can, adjust some of the metrics to get yourself a better score as well. So similar to what Hannah was saying earlier in terms of what you can do, exercising regularly, I think a lot of people think that means like going to the gym and doing these intense exercises, but walking, everyone loves walking. I know that my parents do, and that counts as well. You want to try to do at least 115 minutes a week. Maintaining a healthy weight, I know that this is kind of, it's a big topic. People's weight can be, influenced by other conditions that they may have, but making sure that what you put into your body, like what you're eating, is that no salt, no butter, those types of things still apply. Quitting smoking, managing your stress, and then primary care. I know it's really hard to find a family doctor. I know that's something that specifically in Toronto can be challenging, but trying to stay on top of it. If you know that you haven't had like blood work done in a while, or you have some symptoms that you've just been sitting on for like 6 months, you're not really sure what's going on, please like try to go to a family doctor, or try to get some telemedicine even. Okay, so secondary prevention. Yeah, so they're similar, but essentially I'll start on the stroke side. So after you've had a stroke or a heart attack, you'll be likely put on medications. God forbid that doesn't happen to anyone, but if that is the case, you'll be given medications. And what these are doing is they're preventing and lowering your risk of having another one. And so I don't want to use specific medication terms, but essentially it's either an anticoagulant and an antiplatelet. Sometimes you get both, and that is to reduce the risk of another one. Before leaving the hospital, it's really important, if you can, or if a family member can advocate, who's following up on these medications, when's the next time I'm going to see you, like really making sure that you have good instructions on how to take it and when to take it is really important. So just talking a little bit more about after, there's like the physical health, obviously taking your medications are really important, but like how about like the mental toll that it takes, or that comes as a result of going through something like that. And so, trying to engage in relaxing activities, whether that's deep breathing, mindfulness, talking to your family members, even if it's hard, like there's a lot of evidence that suggests that it actually does help. And so trying to push yourself, I guess, to do that is really important. Obviously, we've talked about like eating well, limiting alcohol, exercising, starting small, and then small changes that build up to bigger changes. Okay. So the Q&A for the second half of the presentation is: what is one small change you can start this week to reduce your risk of a heart attack? There we go. Good. Awesome. Thanks, guys.
If anyone wants us to go back to anything, take pictures of slides, let us know. We can also do that. But if you have any questions, we'll try our best to answer them. We also have lots of physicians in the crowd that can help as well. So.
Go back up.
want to bring it up to your family doctor, you can
It's called the Framingham Risk Score, like FRS, yeah. It's also very Googleable. Yeah, typically, like if you don't have any family history, like someone in your family that had a heart attack at a lower age, you won't really start the screening sooner than that, but after the age of 40, it's like done routinely. Okay, yeah.
Yes, good.
Yeah.
Excellent.
No worries. Also, feel free to find us after if the question you don't want to say.
Thank you, Hannah and Ms. Sandra.
Oh.
Excellent. So that was a great presentation. You know, the next presentation is going to be along similar lines, hypertension and diabetes. And we have Haben and Kasanet that will be presenting this. You know, there's a lot of work that happens, you know, like people around the world are doing research on how to stay healthy, how to live longer. And time again, what it comes back down to is things that we individually most likely will have access to. So walking, running, just exercise. It seems it's simple but tough to do in terms of finding the time. But those are the type of things like in eating well, exercising, sleeping well. Sleep is very important. If you do those three things, the things that we're talking about today, blood pressure, hypertension, stroke, heart attack, you can reduce that chance by a lot more than any of the other fancy things that people talk about in terms of extending life or staying healthy, supplements. It really is stress, so reduce stress as much as we can. Find moments for yourself. Come to EthioCan events where you can talk to people. Like shameful promotion there. And yeah, eat well. Like, I mean, eat well means, I think our forebears had figured this thing out. They, you know, whether you're from the Christian persuasion or the Muslim persuasion, people have figured out like fasting is a good thing. And when you fast, you either fast by not eating or you fast by eating vegan. So I think that's how most people do it. And these things, again, huge science behind them. If you don't eat for 15 hours, which really happens a lot when we're fasting, there's a tremendous amount that happens in the body that is protecting your heart, protecting your brain, helping you live longer. So, you know, we've been handed this by our forebears, by people that came before us and said fast. And we're like, why am I fasting? You're fasting not for religion, for a selfish reason. You can fast because it's healthy for you, right? So you can do this with your own day-to-day life and still stay healthy. So without further ado, I want to bring Haben and Kasanet for the diabetes and hypertension, and I'll just go back in the slides for you guys as well. Come on up. This one. Yeah? Yeah.
Oh, this one. Okay.
Oh, wonderful. Don't worry, a lot of it I don't need to say.
Okay, good.
The people kind of already said it. Yeah.
Excellent. Good.
Back in, do you need this? Here you go.
Is it this part?
I think it's the up and down.
Okay.
You could just try it. Yeah.
Okay, great. Okay. So yes, thank you so much for that introduction.
I need the mic.
My name is Kasanet, and this is Haben. We're both medical students at the University of Toronto, and we'll be speaking to you a bit about diabetes and hypertension, which are both kind of interrelated. Oh, sorry. Okay, so yeah, that's kind of our agenda, just speaking a bit about what diabetes and hypertension are, different types of diabetes, going through kind of what makes a blood sugar level high, and then just ways for you guys to manage your, well, first I guess prevent diabetes and hypertension, and if you have it, strategies to manage it. So I'll be starting off with these. So I guess we can start by defining what is diabetes. So diabetes is a condition in which the body can't make insulin or can't use the insulin that it produces. So insulin is a special type of hormone. It's produced by an organ in the called the pancreas, and it works to help regulate the amount of sugar in the blood. So normally, if you have a very carb-heavy meal, you will have a release of insulin, which will help to kind of lower your blood sugars. But diabetes happens when this whole system doesn't work properly. So in terms of different types of diabetes, there's different types of diabetes, type 1, type 2, and then pre and gestational. So pre-diabetes is kind of this phase where you don't quite have diabetes, but your blood sugar levels are higher than normal, and that's when you're probably at the highest risk of developing type 2 diabetes. Type 1 diabetes is autoimmune disease. So as I mentioned before, the pancreas, which creates insulin, it's being attacked by antibodies that kind of attack it and prevents the insulin from being created because the pancreas is damaged. So often this is usually diagnosed in younger ages and is, and it's kind of a smaller proportion of those who have diabetes. Type 2 diabetes, which is by far the most common type of diabetes, is kind of more related to metabolic risk factors. And it's when you can't use the insulin that the body creates, or the body is unable to make enough insulin. So kind of as written there, around 90-95% of people with diabetes have this kind. And then gestational is kind of a special type of form of diabetes that happens with pregnancy. So in pregnancy, there's a lot of changes in physiology, and one of those changes is kind of how you use and metabolize sugars. So again, this is kind of similar to the pre-diabetes, where if you have gestational diabetes, then you're also at a higher risk of potentially getting type 2 diabetes. So in terms of what to look out for if you potentially have diabetes, so in terms of like common symptoms, so these are kind of symptoms that a person might present to their family doctor with if they are at risk of having diabetes. So feeling really thirsty, having to pee more often, feeling really hungry even though you've eaten 3 meals of the day, fatigue, blurred vision, and unintentional weight loss. And then in terms of like more severe symptoms where you probably would want to seek help more urgently, things like vomiting, feeling really short of breath, confusion, dizziness. And then in terms of what causes diabetes, so there's a lot of myths out there about diabetes being related to eating too much sugar and that causing diabetes. But really, that's kind of, it's more complicated than that.
There are a lot of different factors that go into putting someone at risk of diabetes. So things like genetics, things like family history, ethnic background, environmental and lifestyle factors. So for example, like in terms of like maybe not exercising and stuff like that. So it's really not accurate to say that eating too much sugary foods causes diabetes. Sure, it can contribute if you're eating a lot of sugar and you're not exercising, then you might put yourself at higher risk, but you can't say that that's the cause. It's a lot of things in combination.
So I kind of went over this a little bit, but the kind of the pathophysiology or kind of the mechanisms for each different type. So I guess next thing is I just wanted to talk about what is a high blood sugar level. So there's different kind of ways of measuring the blood sugar. So hyperglycemia is just a fancy medical term for saying there's too much sugar in the blood, and how we can find that out is through different tests. So there's the glucose tolerance test. So this is kind of when
you are fasting, and then they take a blood sample, and you drink a really sugary drink, and then they take your blood sugar again and measure it, and then those are kind of the specific levels. You guys don't have to really bother on the specifics. Your family physicians would know and test for that, but just so that you guys have an idea of the different tests. There's also the fasting blood sugar test, so that's just you fast, and then they measure your blood sugar. And then the A1C, which if any of you guys have diabetes, I'm sure you probably come across that term. So that's basically measure the average blood glucose levels for the past 2 to 3 months. So that's kind of a really key number to see in terms of your diabetes management, if you have it, if you've been kind of
been within range. But also it's often used for the diagnosis of diabetes as well. So normal is below 5.7.
Okay. So in terms of diabetes, one of the biggest reasons why we screen and we try to treat for diabetes is because it has a lot of complications.
And this is really related to having too much sugar in the blood. So in terms of like the small blood vessels in your kidney, in your eyes, they can lead to things like kidney disease or retinopathy, as well as kind of the blood vessels to
like extremities, especially the foot and leg, put you at risk of having diabetic ulcers or neuropathy, which is kind of a fancy way of saying like nerve damage in the feet. So like numbness and tingling in the feet in its early stages. As Anna Lasana mentioned, heart and tract and stroke. So diabetes is one of those risk factors for that. And then I think amputation, usually if there's like ongoing
neuropathy that's like untreated of the feet, but usually early detection and management can help try to prevent that, and most people don't reach that point. Okay. And just being mindful of time, so in terms of just quickly going over how we can measure blood glucose at home. So you guys have probably all heard of the finger stick method. So you prick your finger and then the device kind of measures your point of care glucose or the amount of blood or the amount of sugar in the blood at that point of time. But there's also continuous glucose monitoring.
This is usually if people are on insulin for diabetes, but it's kind of a new up-and-coming technology that is helping people
manage their glucose or their
diabetes better. You probably see people with those kind of in their arms. So I just wanted to put that.
Okay, and then I'll pass it on to Sabin for.
Thank you. And I'm going to continue the rest of the presentation talking about hypertension. So similar to diabetes, you or someone you know, there's a good chance that you know someone that's been suffering from one of the two diseases, as is very common, especially in men in that community. And so hypertension or high blood pressure is essentially meaning that it's talking about the force that blood is hitting the walls in your arteries as it's passing along through your body. And this can have many severe complications and can cause severe damage to the organ. And so I know most of you guys, either at the family doctor's office or local clinic or even pharmacy, have probably gotten your blood pressure measured at one time. And there's usually two numbers that show up. The top one being the measure of the pressure in your vessels when your heart is pumping, and then the bottom one being the pressure when your heart is relaxing. And usually we aim for that nice number of 120/80. But anything, ideally we're trying to target anything below 140/90. So if you do have a value above 140/90, it's a good opportunity to go see your family doctor or check out a local clinic or service in your community to understand if there's any way that you can help manage your disease. So next, what are the causes of hypertension? So there are many. One, as I've been talked about many times in the previous presentation, is poor diet. So adding a lot of salt, butter in your food. There's also a lack of exercise, increasing your stress level, smoking, drinking alcohol, and then also a family history. And then there is a pretty strong link between the two diseases of diabetes and hypertension, and they often, for a lot of people, it'll happen together. And when you have both, it means that your heart is working harder. It means that your blood vessels are under enormous stress, which can cause damage to many of the systems in your body. And then you're at a higher risk of things like a heart attack, stroke, kidney problems, which I know Hannah and Masana talked about in the previous presentation. So who is at risk? So many people in our community have a very high risk of hypertension, and this risk only increases with age, stress, and poor lifestyle habits, so poor dieting and poor exercise. And then what are the signs and symptoms? You know, in many people, they won't present with any signs, and that's why they label as a silent killer, because you won't notice it. And this is why we stress the importance of getting regular checkups before you present with symptoms, because that will often be an indication of a worsening disease, and it's something that's even harder to manage. If you do have symptoms, though, some of the common ones that you will find are things like headache, dizziness, and blurry vision. And then what can you do? And so, you know, I won't go into too much detail about this because I know it was talked about a lot, but often the things that we can do are very simple and they're very manageable, even, you know, without the need of medications or severe interventions. So things like diet, decreasing your salt intake in your fried food, eating more fruits and vegetables, having things like lentils, beans, leafy greens, all things that are very common in our own diet. I know some people are taking pictures. I hope you guys got them. Things like exercising can help your heart stronger. It can help lower your blood pressure. It can reduce stress. There's so many positive implications of exercising that go beyond just, you know, improving your your weight or your physical appearance. And then, yes, I'll skip over this, but these are just the guidelines for people between 18 and 64 on how much exercise you should be doing per week. And then lastly, what are the other options? So regular screening. So blood pressure, just go to your local shoppers or Rexall and go get your blood pressure checked regularly. It's recommended that you get your blood sugar testing every 3 years. And I'll talk about where you can get them done as well later. But then there's also non-medical management. Outside of exercise and diet, it's managing stress, sleeping, quitting smoking or alcohol. And most importantly, you know, we don't want to dive too much into medications because that's something your doctor can worry about. But it's so important to keep taking your medication as prescribed. Even you know, a lot of people, they're not going to have any symptoms. They're going to be feeling better. To continue taking your medication is very important because you don't want to be in a position where you know you're really suffering and you're only treating something when it's there. You want to prevent it, not treat it. And then lastly, if you do want to switch your medications to stop, always be in communication with your family doctor or whoever is managing care, as they can help you advice on how to adjust your medication, your treatment in a way that best suits your wishes. And so resources. As was mentioned previously, you know, finding a family doctor can be very difficult. Going to a local clinic or an emerge can be very busy. But there are resources out in the city to help you. So things like the Toronto Central Diabetes Education Program. This is something you can just look up, but they have programs all around cities at different community centers that a lot of them are free, that you can go and learn more about how you can manage your diabetes specifically and get testing. There's community health centers. There's online webinars like Lifestyle RX, which is free for anyone with the OHIP card, that you can get free programming and counseling through for many different diseases, including hypertension and diabetes. And then there are all these online resources that can help you if you do have questions and want to learn more about what you can do specifically. And so at the end of the day, just to summarize what we talked about, diabetes and hypertension are very prevalent, and many of these people who have them aren't going to have the symptoms. The most important thing is early action and prevention. I know we had all these guidelines on how much exercise or what to eat, but any change, even small, is a positive change. And so that might mean, instead of sitting down all day trying to get up for 5 minutes or 10 minutes every hour or so, and just moving your body, it's maybe changing one meal a day and making it healthier. These small changes are all positive steps, and instead of trying to, being so worried about changing your whole lifestyle, it's about making the small changes that can have a big impact. And then lastly, getting regular screening, even when you feel well, is really important. And lastly, thank you so much for allowing us to present. And again, please let us know. So most of these diseases are managed. I know people with pre-diabetes can lower their sugar, but most of them are lifelong illnesses. But they can be managed, and for many people, it's managed. They can manage them non-pharmacologically, so without medication. So typically it is lifelong, but you can lower, or you're diagnosed with it, but you can very much manage it and treat it to the point where you're not suffering from any of the symptoms and your condition is not worsening.
Just to add a comment, I mean, diabetes and blood pressure, የደም ግፊትና ከውፍረቱ ሊመጣ ስለሚችል አሁን ስኳር ያለባቸው ሰዎች በውፍረት የተነሳ ወይም የደም ግፊት ችግር ያለባቸው ሰዎች ግን ከውፍረት ጋር የሚመጣው ሰውነታችን በቀነሰ ቁጥር እነዚህ ነገሮች ተመልሰው ኖርማል ሊሆኑ ይችላሉ ማለት ነው። ከስኳሩም ሊጠፋ ይችላል፣ የደም ግፊቱም ሊጠፋ ይችላል እና አንዳንድ ጊዜ ሪቨርሰብል ወይም ተመልሶ ኖርማል ሊሆን opportunity. So some of the causes of hypertension, diabetes can be reversible, like obesity, things like that. So, but for the most part, if you're doing everything possible and your blood sugar is high or your blood pressure is high, like Habib said, it's important to manage it as a long-term issue to lower the blood pressure as much as you can, so that you don't suffer the complications of diabetes, for example, like blindness or losing a limb, like a leg, or so you don't want it to get to that point, then it's really not much you can do about it, right?
Oh, your microphone. Sorry.
So a friend of mine, he was diagnosed like he's diabetic, and then he was taking medication. And then once he started doing exercise, and he told he's feeling better, so he just quit the medication. So after that he would be fine, or it will be like more dangerous for him to stop the medication.
I guess my first he quit it because his doctor said he didn't need it anymore.
He didn't consult the doctor.
Okay, well, I guess my first piece of advice is to always consult a doctor, or if you can't access a doctor, to go to like diabetes education center and stuff. Because the only way that you know that you're improving your diabetes is by looking at things like your HbA1c and having a professional kind of interpret those and decide, whether I guess medication is needed or not. There are people who get off medication, usually like what Havin was saying, kind of in the pre-diabetes phase. But like lifestyle interventions for diabetes are so powerful. So and things like healthy eating, like exercise, can really make a difference. So I don't really have an answer to your question per se, but I would say that they should try to find a doctor.
Yeah, because after he quit the medication, he was fine. And again, without consulting the doctor, started medication.
Okay. Well, the thing is, kind of what we were saying with, even with hypertension, you might feel fine, but sometimes it's about those long-term complications that you're preventing, again, neuropathy, so kind of blood flow to the feet, or eye issues. So again, I think if you have a family, if they have a family doctor, that would be like the best thing. But sometimes you might feel perfectly fine, but things are happening with the like high blood sugar that can cause damage that has long-term consequences. Thank you. No worries. Thanks, guys.
Thank you for having and Ksenia. That was a great presentation. I really want to reiterate, I know it's been said, but you know, I have a family history of diabetes and blood pressure, both my mom and dad. So I have to be careful in terms of lifestyle choices and your weight, that's my son waving. You have to be careful as well. You have to eat the right things and exercise. So it really is prevalent. I mean, the fact that it's in my family may mean that it's just so common that it just happens to be my family, or it may mean that, you know, genetically there's something that's passed on from one generation to the next that puts me at risk of these diseases. So since lifestyle and dietary changes are so powerful, you know, that's the one thing I can hang on to, right? And then checking with your doctor, you know, it's either your blood pressure is high or not. Either your friend's blood sugar is high or not. So it's a simple check, and then you can know, you can be safely off the medication, you're good, because your exercise and things you're doing are making a positive change, or despite what you may feel, you feel great, but your blood sugar is high. So you're at risk of having a heart attack, having a stroke, losing your eyesight, getting an amputation, so you should rethink the medication. So these are really objective. It's not like the doctor says, I feel like you should be on it. You just do the test, and either you're on the medication or not. So that's what I would say to your friend. So we'll continue with the next. With our next presenters, Eden and Soliana. These are first year University of Toronto medical students. I want to congratulate them for starting UFT. You can clap for them. It's a big accomplishment. I remember getting that letter and I thought my life was sorted. I'm like, yes, I made it. But it really is, in a way it is. And then you have a lot of great choices ahead of you as well. So congratulations and good luck with that. I also wanted to congratulate Musana, who has been accepted to one of our anesthesia programs. So she's going to be putting you to sleep when you have surgery. So congratulations. That's a very competitive program and specialty, and it really is a testament to how brilliant these future colleagues are. So Aiden and Soliana, come on over. We'll cue your immunization and hepatitis B talk. Does someone have a question? We're good. Okay. So, come on over.
So we're going back for it. Yeah. Thank you. Where's this one sounds like it's on. Where's the thing? Oh, he has. Oh. Yeah.
Look, I think we may have some technical issues. Just give us a couple of minutes. Christina around? Christina?
Oh, this.
Yeah, just press down for the next section.
Okay. Hello, everyone. My name is Eden.
And my name is Soliana.
And we're both first-year medical students, and we're going to be talking mostly about immunization and how important that is, and we're also going to be speaking a little bit about measles, hepatitis B, and shingles. So first of all, what is immunization? So basically, immunization is training the immune system to fight infection. And how we do this is through vaccines. So vaccines, you get vaccinated, and that exposes you to a harmless antigen. And that produces antibodies in your immune system, which causes your immune system to create lots of different cells that are prepared to fight this infection. So when you're exposed to it, you'll be able to have memory in your immune system, and you'll be able to fight off whatever infection it is quicker. And it protects individuals and communities, which is why immunization is so important, because you're not only protecting yourself, but you're protecting the people around you.
Okay, so why should we care about vaccination and immunization? As Eden mentioned, it can
severe illness and complications. So when you get vaccinated, if you do happen to be exposed to a particular virus, it stops you from having symptoms that are as severe as you would if you weren't vaccinated. Additionally, it can protect vulnerable populations. It can reduce spread through herd immunity. And so herd immunity just refers to when enough people in the population are vaccinated, that basically reduces the spread among the population.
And it's important to note that some diseases like measles are coming back, as there happens to be, I guess, a lowering in the amount of people who are choosing to vaccinate their children with the MMR vaccine. And so it's important to, again, think about the necessity of vaccination for the prevention of the spread of illness in our community.
So what's inside a vaccine? Generally, there's three components to a vaccine. There's the antigen that you're getting exposed to, which triggers the immunity. There's an adjuvant, sometimes, which boosts the response and helps you fight off the infection quicker. And there's also stabilizers and preservatives, which help with the safety and effectiveness of the vaccine.
So again, to emphasize, early protection is key. So many vaccines are given in infancy and early childhood to protect against serious infections down the line. So some of the examples are MMR, which covers measles, mumps, and rubella, the DTaP vaccine, which covers a variety of infectious illness, as well as the hepatitis B vaccination.
So now we're going to be talking about our first disease a little bit, which is measles. And measles is a highly contagious infection. It spreads through the air, and people have a common perception that it only affects children, but that's not the case. It can affect both children and adults, but we've been seeing an increase in the number of children getting measles. So ways to recognize measles is there's this thing you can see a fever plus the 3 C's. So what the 3 C's are cough, runny nose, and conjunctivitis, which is basically just pink eye. You might also be seeing something called complex spots, which would be little spots that you would see inside the cheeks. And you might also notice a rash that starts on your face and then spreads downwards.
So these are some pieces of advice if you do suspect measles. So the first thing is to isolate immediately. Measles is very contagious and it's airborne, meaning that it spreads through the air, so through droplets in the air. And so it is very important, that isolation piece, as well as avoiding waiting rooms and public spaces. So of course you would want to seek the advice of a healthcare professional, but it's important to notify providers before arrival. So making sure to call, a local public health unit and notify them of the suspected case.
As well as using appropriate precautions. So again, masking when possible and airborne isolation. And again, just emphasizing that the most important piece to prevent measles is vaccination.
So now we're going to speak briefly about hepatitis B. And basically what hepatitis B is a viral infection that affects the liver. So it can be spread via multiple routes, such as through blood, sexual contact, as well as birth. So if the mother has hepatitis B when she gives birth, she can pass that along to the baby. And hepatitis B can present acutely, so short-term, and also chronically, which means it can become a long-term disease. And when it becomes chronic, it can, your liver can get really affected, and you can get cirrhosis, which is basically the permanent scarring of your liver, which is irreversible, and you can also get liver cancer.
So some of the symptoms of hepatitis B, as Eden mentioned, there is acute and chronic symptoms. So with acute, you would experience fatigue or tiredness, jaundice, which is basically a yellowing of the skin and of the eyes, and also keeping in mind that many of us have darker skin tones, so especially looking at the eyes to see that yellowing. Also nausea and vomiting, as well as dark urine. And in terms of chronic infection, you may see that it is asymptomatic, so you aren't experiencing these same symptoms as an acute infection. However, as Eden mentioned, there is damage to the liver, and so it's important to keep in mind those long-term effects as well.
And so how do we prevent this from happening? Getting vaccinated. So vaccination for hepatitis B is routine in Canada. You get it when you're a baby. You get a bunch of different rounds of the hepatitis B shots. You might not even remember getting them. And you can also get it boosted later in your life. Another way to prevent it is through safe sex practices and avoid sharing needles, of course. So you can also get screened for hepatitis B, and people that are high risk are people that should be screened, and as well as pregnant patients who should definitely get screened for hepatitis B, just to make sure that the baby is not getting exposed to this illness.
Now we'll shift gears and talk a little bit about shingles. So in terms of what shingles is, it's a reactivation of the varicella or chickenpox virus. So if you've had chickenpox as a child, you may be at risk of developing shingles in the future. And again, this risk increases with age and weakened immunity. So for instance, if you acquire a virus or something that weakens the immune system, it can cause shingles to occur. And in terms of signs and symptoms, it can appear as painful,
burning or tingling sensation. It tends to kind of be localized to very specific areas or one side of the body. And with this rash, it can come with these fluid-filled blisters that may tend to crust over as well. And it's important to note as well that after the rash subsides, pain can still persist. And it's this like neurological pain.
And of course getting vaccinated is a way to help prevent shingles from occurring. There's the Shingrix vaccine, which is recommended for adults that are 50 or older. It's really important to note, though, that this vaccine is only covered in Ontario for people who are 65 to 70 years old. So please just make sure of that when you're thinking about cost. And you can also treat shingles early with antivirals, which can reduce the severity of your symptoms. And also, if you have increased pain, or if your rash develops and grows bigger, we're encouraging you to seek care for that.
Okay, so this is a broad overview of some safety recommendations. So the main thing is to stay up to date on your vaccinations and ensure that children are receiving their routine immunizations post-birth as well as in school as well when they're older. For adults, it's important to check their status for MMR and hepatitis B. I actually had to check my status for MMR recently for school, and I found out that I was no longer immune to rubella, so you never know, and it's important to stay up to date and check with that. And for that, I had to get a booster vaccination. And so, again, a big thing that we'd like to emphasize is if symptoms appear for any of these illnesses, it's important to seek care and notify the appropriate healthcare professional to get the assistance that you need. And in terms of where to seek care, you can reach out to a family doctor, you can seek care at a walk-in clinic, as well as public health clinics.
For these issues.
So we have a couple of myths and facts that are just listed on this slide. So There's a common
perception, or some people think that vaccinations can cause autism in children, but this is not true at all. It's based on a retracted study. It was not performed well. They did the study on like 12 kids, and then they decided that since those kids might have had some of the symptoms of autism, then the vaccinations led to autism, but this is not the case at all. You will not get autism if you get vaccinated. There's also the perception that if you get vaccinated, you're going to get the disease, and that's going to overwhelm your immune system. But this is not true. As I mentioned before, vaccines expose you to a harmless antigen that's related to the disease, but you're not actually getting exposed to the disease itself, so don't worry on that front. And vaccines are very safe, effective, and heavily studied. I feel like we presented some scary diseases to you guys, but we just want to make sure that you're up to date on your vaccines, and that if you're getting screened and getting vaccinated, a lot of these things won't happen. So just get vaccinated. Thank you.
I'm not sure if there's any questions? Or if you'd like, okay. So I guess you would go to your doctor or to a walk-in clinic, and you can request for your blood to be drawn, and then they check that way. And so they can give you a report on all of the different illnesses, like viral illnesses that you would be immune to. Yeah. Okay.
Good. Any other questions? Thanks so much to Eden and Soliana. Another round of applause. So, I mean, vaccines are such a, we've heard about it, obviously more recently with COVID, but we've heard about it all our lives because we get vaccinations as kids. But big picture, vaccines may be the way we actually prevent cancers in the future. And next talk, I know my colleagues are going to touch on one cancer that is already preventable with a vaccine. So this is more of the future. So I think some of that awareness and dispelling the myth around vaccine is important because we may be in that position in the future where that's how you prevent colon cancer, that's how you prevent breast cancer, right? So I kind of fully support all the data these guys, these budding scientists have presented us, and thank you for that. Now next is a bit of a bigger topic as cancer screening, and Sador and Sami have decided to take this on, and we thank you for that. Without further ado, we'll get into how do we look out and prevent cancer? How do we get checked when we're feeling well? What are the programs that are out there? And please listen carefully, ask questions. At this point, I can ask the room, and probably 80, 90%, maybe 100% of people will know someone that's been impacted by cancer. And there is a way to reduce your chance of getting cancer. Again, it comes down to diet, lifestyle, sleeping well, minimizing the stress, but also getting checked when you're feeling well. Okay. Yeah, it's going to be Sami and Sador.
Okay, or?
Yeah.
Okay. Thank you.
Just keep the mic
close to my mouth. Yeah, sounds good.
Okay. 2 mics I can share.
Either way. Thank you. Should I go the wrong way?
The beginning.
Hi everybody, I'm Sador, this is Sami. We're medical students at U of T as well. I'm in my 3rd year and Sami's in his 4th year. And who's in the audience also helped with putting this presentation together. But as Dr. Kalkidan was saying, we'll be talking about cancer, which I think is a really scary topic to many of us for the reasons that he mentioned. I think so many of us know someone who's been affected by cancer, if not even like you directly. But what we want to do with this presentation is give you information that can make you feel like you're somewhat in control. If you know what to look out for, if you know what to do to check for cancer, cancer when you still feel fine, then you can lower your chances of finding it at a late stage and instead finding it when it's still small, early on, and very easily treatable at that stage, okay? So we're going to start by talking about what cancer is. Then we picked 4 specific types of cancer that are more common, but also that have screening interventions or things you can do to feel in control. And then we're just going to wrap it up with, you know, some concluding thoughts, okay? Okay, so I guess first off, what is cancer? Essentially, our body is composed of many, many healthy cells, many normal cells. With cancer, your cells become abnormal. They become unhealthy. And as a result of this, it continues to grow and grow and grow uncontrollably to a point where it might spread towards your entire body and cause a lot of health issues. If not treated, it ends up being fatal. And obviously, again, we all know maybe someone who's died from cancer. And those are the really sad and scary cases that we want to avoid. Sometimes we compare it to a car that's just like driving uncontrollably with no way of stopping, almost like the brake isn't working. There are many different types of cancers, over 200 types of cancers, but some are more common. So you may have heard of some a lot more than others that you maybe have never heard of. Some of the common ones are lung cancer, breast cancer, colorectal cancer, and today we've picked 4 to talk to you about. Now, if you go to your doctor, either maybe because you've done some tests or you know, some screening for cancer, they might be using certain words that are important for you to know, just so you understand the details of what it is that they're presenting you with. One of the words is stages. So stages refers to how much the cancer has spread throughout your body. Stage 1 means very, very little spread. Stage 4 means a lot of spread. So obviously, as you'd imagine, stage 4 is not, like, is worse than stage 1. Another important term is grade. I don't know what happened with the words over there, so you can just pretend that it's written properly. But grade refers to how aggressive the cancer is. So grade 1, less aggressive. Grade 3 or grade 4, more aggressive. Okay? And then, as I've mentioned already, like, I think there's a lot of emotional connotation to cancer, as in you hear the word cancer and we get really, really scared. Treatments are improving. There's a lot of money that goes into research for cancer therapies. 20 years ago versus today, very, very different. And in the next, I don't know, 20, 30 years, it's going to continue to improve. So hopefully when you hear the words cancer in a doctor's appointment, you don't get, I mean, of course you'll get terrified. I shouldn't say don't get terrified, but know that, you know, your healthcare team is doing everything they can, and they have options for a lot of the cancer that exist to help you have the best health outcomes, okay? But what can you do before we get to that point? So a big thing with cancer is cancer prevention. How can you keep yourself from even developing cancer? And so there are some things that will put you at a lower risk. So for example, general checkups, ensuring that you're going to your doctor and, you know, getting whatever blood work they recommend, starting on any medication that they recommend, and just ensuring that everything is in line. Also, we'll talk about some of the specific cancer screening that is available to you, but go and do cancer screening. We'll talk about mammograms for breast cancer. We'll talk about colonoscopies for colon cancer. So make sure you're doing those in the ways that the health officials have said. So if they say do it every 2 years, do it every 2 years. The other big one is pay attention to your body. You are the expert on your body. You know what's normal for you. You know what's not normal for you. So if you feel like you're very, very tired in the last 2 months, but before that you were completely fine, go to your doctor. Tell them, I feel fatigued, but I don't know why. If you feel like you're losing a lot of weight, but you don't know why, you're not dieting, you're not exercising, that's maybe not normal. You should ask your doctor, go see what's going on there. The other thing is if you feel a lump in your breast, a lump somewhere else, if you feel something that could be a mass caused by cancer, it might not be, it might be benign, but you should go and ask and get it checked. The other thing is you want to avoid some carcinogens. What that means is there are certain things that have been known to increase your risk of cancer. Things like smoking. So, look into what are the different carcinogens. We'll talk about some things in our presentation, but know what they are and try your best to avoid them. And then the last one is being healthy. I think not just for cancer, but everybody's presentation said exercise and eat well. And that's not an exception here. If you exercise and you eat well, you also reduce your risk of cancer. Okay? So, question for you guys. What steps can be taken to lower your risk of cancer? The options are quitting smoking, exercising, eating a healthy diet, or do we think it's everything? By a show of hands, who thinks it's A? Or actually, go ahead. Yeah, exactly. I think we all can, get to that conclusion, so thank you for sharing that with us. The answer is, of course, D. Okay, so now we're going to talk a little bit about breast cancer. So I'm not going to go into the details of, the words that are on this slide because it's simply not that important for you. But what you should know is that breast cancer can start in different parts of the breast, and that's how they label the type of breast cancer that you have. At the bottom, you'll see two words, in situ, or non-invasive, and then invasive. That just means that it's expanded beyond the specific type of breast tissue where the breast cancer started. So invasive is a little bit more advanced than in situ, for example, okay? And the most common type is ductal carcinoma, but again, these words aren't too important. What you should know is that breast cancer is one of the most common cancer amongst women, where they say about 1 in 8 women in Canada will develop breast cancer in their lifetime. And for Black women, often they find that it presents more aggressively and at a younger age. There's a type of breast cancer called triple negative breast cancer. It's more aggressive, and they see that more in Black women. Okay? So just some statistics to emphasize why it's so important that you do your screening. Now, some early signs of breast cancer are things like you may feel a lump. You may feel a lump from something benign, something non-cancerous as well. But what they say about the breast cancer lumps is that often it doesn't cause pain, whereas some of the other ones might cause you to feel pain. You might find that the breast tissue or the skin around might feel different or look different. Some people will have like a rash or different kinds of dimplings in their skin. You also might notice changes to the nipple. Sometimes people will find discharge from the nipple or blood coming from the nipple, which they didn't have before. I'm seeing some facial expressions that are, and I agree, like these are not great things, just important for us to know. And early stage breast cancers are often very treatable, but it's just important that you pay attention to them so that you can act on them quickly. Some of the later stages, which means it's spread to more of the body, would be things like maybe you're having some bone pain, which could be an indication that it's spread to the bones. Some unintentional weight loss. Maybe you're very nauseous all the time. You've lost your appetite. Sometimes, some yellowing of the skin, some jaundice. Shortness of breath, especially in cases where it's spread to the lungs. And then just like overall fatigued and muscle weakness. Now there are some important risk factors, and these are the things you can do to lower your chance of developing cancers generally, and in this case, breast cancer. So often, age, you can't really modify that, but if you're over the age of 50, you're more likely to develop it. Family history. If you have family members who had breast cancer, it's important that you bring that up to your doctor so they're aware, and they'll adjust when you should get screening and whatnot based off of that, or even send you for genetic testing. And speaking of genetic testing, there are some genes that put you at a higher risk of developing breast cancer, so it's good to know about, if you have the BRCA1, BRCA2 mutations, and there are other ones as well. People with dense breasts, for many reasons, and even imaging, like the screening in the mammograms, are harder to see and identify breast cancers in people with denser breasts. So that's another important one. And then, you know, obesity, also just like physical inactivity. So if you can be active, that's a major one. They'll ask you about your reproductive history as well. If you've had kids, if you've been on birth control in the past, whatnot, because these things can help stratify your risk as well. Alcohol, as with smoking, try and reduce the amount of like substances that you take in. And then some hormonal replacement therapies like HRT therapies as well. But what's important with this is you just need to talk to your doctor before starting medication and ask them, this is what I'm scared about, this is what I want to use it for, what do you think? And talk to them through your decision making, okay? So another really important slide here is what you can do to catch cancers early before it's spread to those advanced stages. So for breast cancer, there are mammograms, and it's an Ontario breast screening program that is available to everyone free of charge. And if you're between 30 to 70 and of higher risk, that's something to talk to your family doctor about, because they can, you know, start these screening programs even as early as 30. But for the majority, once you're 40 onwards, you can go and get mammograms as per these guidelines. So mammograms every 2 years. If you're 40 to 49, you may need to talk to your family doctor first, but 50 to 74, go do your mammograms every 2 years, don't forget. And I think some people say that there's pressure and it's uncomfortable, but it's not painful per se, okay? So, question here, at what age should we be going for our mammograms? Anyone? Blurt it out. Yeah, I heard 30, 40, maybe I heard 50. Yeah, great. So, you know, around 40, start thinking about it, talk to your family doctor, or, you know, walk in and go get your mammograms. So then cervical cancer, and Dr. Kalkidan was talking about how there's cancers that can be prevented with immunization and vaccines. And he was referring to cervical cancer. So again, I'm not going to go into the little details here, but what you should know is cervical cancer starts in the cervix, and that's the area kind of right under the vagina. And what's important here is that cervical cancer is caused by HPV, human papilloma virus, and that's a sexually transmitted virus. And there are specific subtypes of it that are of higher risk of causing cervical cancer. But essentially, there is a vaccine for HPV, a vaccine that will help prevent cervical cancer as a result of preventing you from having HPV in your system and whatnot. So in the case of cervical cancer, again, you can see the proportion of patients dying from it is not that great. Like they said, 1,600 would develop cervical cancer, and 400 will die from it. These are not fun stats to see, very scary, but it's pretty much curable with the vaccine. And black women, again, unfortunately, find themselves at higher risk and also dying from it more. Some of the early stages, sometimes it can be really hard to even know that it's there, because a lot of the symptoms are either vague or there just aren't symptoms. What some patients will say is that they've been experiencing some bleeding between their period, or maybe some bleeding after sex as well. Also perhaps some pain with sexual activity. And then also some changes to their vaginal discharge. Maybe it smells different, maybe it looks different. And my point about you are the experts of your own body, you need to know what your normal is and pick up on signs that are outside of that. In the later stages, often you'll find other symptoms based off of where it has spread to. So kind of like what I was saying about breast cancer, you might have back pain. In this case, because the cervix is close to the organs that would be related to this, you might have some difficulty with peeing, or with stool as well. Some swelling in the legs, you might always feel fatigued, and you might also be experiencing some unintentional weight loss. So those are some important signs and symptoms to look for, and times where you should definitely go see your doctor if you're experiencing them. And then some of the risk factors that can increase your chance of developing cervical cancer is, again, HPV exposure without being immune through the vaccine. Having a weakened immune system, so again, things like smoking, reducing your exposure to smoking. Patients who are immunocompromised, maybe through like HIV or something else. And then some like more long-term use of some like birth control pills or multiple pregnancies. But I think I say this very, very carefully, because this doesn't mean don't use birth control or don't, get pregnant, but more so it's to say that you should talk to your doctors, as they will help you kind of risk stratify and decide if something is good for you, because they know the big picture of your health. But again, cervical cancer is preventable with a vaccine. And that's what I'm going to talk about now. So the HPV vaccine has started being given in schools. I think like when I was in grade 8, they were giving it in grade 8. I don't know if the exact year has changed. But often they say the best time to give it is between 9 to 15 years old. But up until age 45, you're able to still get the HPV vaccine. And this might be continuing to change. So I think no matter what age you are, it doesn't hurt to ask your family doctor and say, hey, like, am I within the window where it would be helpful for me? It's nearly 100% effective for preventing HPV-related cervical cancer. So that's huge. Like, we don't have that with a lot of the other cancers. And if you can do this for one, then that's already something very big that you're doing to improve your health. And then, of course, safer sex practices are very important. And then there's also screening available for cervical cancer. Now that screening is called HPV testing, similar to Pap tests not too long ago, but it would involve having like a speculum inserted into like the cervix, taking a sample, and then testing it for HPV and some abnormalities there. And so again, if you are over the age of 25, sexually active, very important to go and get your HPV testing. Okay, another question for us. Is HPV vaccines covered in Canada? I think I heard a whisper of a yes, and I saw this in the audience. So yes. Yeah, great. It is. And you can normally get it through school, but if you miss the window for some reason, go talk to your family doctor, okay? And on that note, I'll pass it to Sammy.
Okay, great. Hello, everyone. I'm going to start by talking about prostate cancer.
So first, what is a prostate? It's one of
our organs in our
reproductive system, and really the role of it is to nourish the reproductive fluid. And we spoke a bit about what cancer is, and cancer really is just an abnormal growth of cells. And the type of cells, we name it as cancerous. So when that happens in the prostate, we term that as prostate cancer. And usually what will happen is that prostate will grow larger and larger and larger. And the exact cause of it is really unknown, unlike some of the other cancers that Sadar has spoken about. So it's really important to kind of get ahead of it, understand the signs and symptoms, and go from there. Luckily, it's one that also grows very slowly. So it won't have a large impact in terms of kind of that right away, you feel the symptoms right away. But it's really a slow growth over time. And if we find it at an early stage, it's very treatable as well. So in terms of the statistics, in Canadian men, excluding skin cancer, it's actually the most common cancer found. And it also has a large mortality. So we see a third leading cause of death from cancer for men in Canada. And that's just due to how many people get it. So once again, it's very important to kind of be proactive in it and trying to get ahead, understand the signs and symptoms, and go from there. And I'll speak to you about that. And kind of before we go through it, I just want to recognize that if you have one of these, it doesn't mean you have cancer, right? You don't need to freak out, run to the hospital and I think you have this cancer and waiting to merge for 10 hours, but it's just something for you to think about when you see your family doctor. It's good to bring this up as a question. And that goes for a lot of the symptoms that we saw throughout these presentations, but I'll start with the urinary symptoms. Like I mentioned, it grows and it gets larger and larger, and in that area it can kind of obstruct certain pathways, and one of those being the urinary pathway. So first, blood in the urine. It can kind of nick a blood vessel and it cause some bleeding and irritation in the area, so we might see some blood. Blood in the semen as well, kind of the same reasoning behind that. Finding that you need to urinate more often. Trouble getting started when trying to urinate, as well as spotting off when you wake up at night as well. And the later stages, that's kind of accidental leaking of urine. That's something, when you get older, it might be a bit more common, but when you find that it happens all of a sudden, when you're younger and really unexplained, as well as back pain. Prostate cancer is one of the cancers that can really move to other parts of the body, and it's called metastasize. And one of the places it most commonly goes to are the bones. And that can be throughout your body, but as well as the back. So kind of the back and the bone pain is related to that. And unintentional weight loss as well. And this kind of goes for almost all cancers. You'll see this constant inflammation over a long time and cause your weight to kind of go down. And risk factors. I think we've seen these risk factors for so many of the different diseases, conditions, cancers that we've seen. So it's really important to keep mind of it, and also have these conversations with physicians or healthcare practitioners that you see. So once again, the age, the ethnicity, which as you see there can affect all of us in this room, the family history, as well as obesity. So really watching what you eat, making sure your lifestyle factors are correct, as well as your diet. And then screening. Unfortunately for prostate cancer, we don't have the best screening test for it. What we do have is something called the prostate-specific antigen. It's the PSA, commonly known. And it's a blood test, and what it does is it kind of gets affected for a lot of different conditions. So if you have an infection, it might go up. If you have some other irritation or inflammatory conditions, it might go up. So it's not very specific to cancer, but it is a tool that we use to identify the risk in terms of cancer, and whether we need to do a bit more investigation. So once again, there's no exact amount of years that you need to get this done, but along with some of the risk factors I mentioned before, and maybe you're having some of these symptoms, it can be important to get this done. And this is a conversation, once again, with your family doctor. So I'll talk a bit about colorectal cancer now. So I'll start with what the colon is. It's part of the large intestine, and colorectal includes the rectum as well. And these are kind of responsible for the water and nutrient absorption, as well as excretion. And cancer, once again, is these abnormal growth of cells. And this can really happen all over the body. And in this case, it happens in the colon as well as the rectum. And a lot of times these will start from something called polyps. So in your intestine, there's a bunch of tissues there, right? It'll travel all the way through when you're eating, and you'll go to the bathroom. With a lot of this tissue, there's also a chance for this tissue to overgrow. And just because there's an overgrowth doesn't necessarily mean it's cancer. It could be these polyps as well. And a lot of times polyps are benign, so they won't necessarily progress to cancer. But these are usually what causes cancer. So not all of them will, but we usually like to take a look and investigate whether these will progress to cancer. So once again, the stats. We have our 2024 stats here, and 25,000 Canadians were diagnosed, as well as almost 10,000 died from colorectal cancer in 2024. So it's a bit more deadly. So once again, it's something to really keep an eye out for and understand the signs and symptoms. So here we go again. Just a pre-warning. Some of these symptoms are actually pretty common, right? And just because you have one, you had today's saga and now you're in the bathroom the whole day, it doesn't necessarily mean that you have colon cancer, but unexplained diarrhea or constipation, changes in terms of how your bowel movements look, feeling like you're not able to let's say you go to the bathroom, you pass a bowel movement, and even though you did that, you feel like there's still some left. Once again, blood can hit a blood vessel, and it can cause some bleeding in the area as well. So these are some of the things you want to look out for and speak to a healthcare practitioner about. And once again, some of these later stage symptoms, the unexplained weight loss, like I mentioned before, abdominal pain, and persistent nausea or vomiting is related to if it happens to block your intestines, and it really goes out the other way than passing a bowel movement. So risk factors, I think we can see them here as well. Pretty similar, once again, kind of making sure you understand the risk factors and addressing them, and having conversations about kind of reducing your weight, stopping smoking, reducing your alcohol consumption, and the last one's inflammatory bowel disease. And then there's a bit more robust screening with colorectal cancer. First, in people with normal risk, it's really the FIT test, which is the standard of practice, and this is just checking for blood in the stool, and usually do this every 2 years. And once again, identifying your risk, you want to speak to a family doctor, see where your risk level is at and what type of testing that needs to be done. And in high risk, you tend to be doing colonoscopies, so taking images throughout your colon and rectum and seeing if there's any of those polyps and if any of those need to be removed. Yeah, thank you.
And if there are any questions, my understanding is we have surgeons who deal with cancer a lot who we're going to take over the question period. So if you have any questions, these are definitely the best people to be asking them to. Any questions?
I mean, you guys can answer the question because you did the presentation, but
Sounds good.
I'll introduce briefly Dr. Betty. She's okay. So yeah, Sador and Sami can answer these questions. If you have more additional specific questions, we can help as well.
Thank you very much for your presentation. It's really interesting. So far, what I noticed from your presentation, especially the black community are attacked from that cancer. Is there any environmental or DNA issue? What was that? You know, when I see from all the presentations, especially in the cancer area, the black community. But what I noticed in the normal condition back home, I see all, especially in Ethiopia, we don't see too much cancer patients. Now it is gonna be, it's a new phenomenon. So what was that? Do you have any study or any things to share out, please?
If I were to say, it's actually a combination of both. So there may be a genetic factor playing into it, as well as our lifestyle and environmental factor. Of course, if we grew up in Ethiopia or Eritrea, the types of food we eat, the lifestyle that we have is very different than the one we have here. But also some genetic factors have been studied as well, and there's always ongoing kind of investigation. Studying it, it's also very hard to delineate is this because of the lifestyle or is this because of genetics, right? So it's an ongoing place of research. But I also think it's important realizing this, what can we do about this, right? We have to be a bit more proactive in kind of understanding our risk, as well as doing the screening that we're supposed to and keeping an eye on some of those symptoms.
As we said for black women that we should be getting tested like earlier since we're more likely to get breast cancer. On the screen it said 40. Is 40 a time that like black women should start getting tested for breast cancer, or should we be going younger?
I wouldn't say just because you're a black woman you should be going younger. Like 40 is anyone can get mammograms. But it's more so to say like be on higher alert. Ask your family members, has anyone had breast cancer? At what age did they have breast cancer? And talk to your family doctor, early on, because they may tell you what the questions are to understand if you're a higher risk patient, and then they'll help you kind of discern if you should do mammograms at an earlier age or not. Because being a black woman is not a risk factor per se, but it's more that
there's more triple negative breast cancer that's more aggressive amongst Black women. Black women are getting diagnosed younger and whatnot. So I think it's just important to keep that in your mind so that you know what questions to ask your family members, and also your doctor can then decide if you need like genetic testing or whatnot to then let you know if you should do like higher risk screening protocols. Does that make sense? Okay. Any other questions? Okay.
Thank you. Thank you, Sador and Sami. And I want to mention that we have a lot of medical trainees at different points in their training. So Sami, as you heard, is in fourth year, which is the final year of medical training at U of T, and he's just recently been matched to what's called internal medicine. Basically, these are the smartest people in the class. Thank you. So, so if you're an internal medicine specialist, basically you're fixing everything. You know, you have a cardiologist, internal medicine. You have a gastroenterologist, GI doctor, that's them. You have a joint doctor, rheumatologist, that's them. So they do everything. So you got to know a lot. So he's just going to be starting in July his 5-year, probably 7-year training. So it never ends, but it does. It does. Congratulations, Sami. Yeah.
Okay, I would like to say thank you to all the presenters. Now, ላቀረቡልን ሁሉ በጣም ከፍ ያለ ምስጋና እናቀርባለን። ወጣት እጩና ያው ጨርሶ የደረሱም አሉ እና ለሁሉ በጣም እናመሰግናለን። እንደ ማህበረሰብ በጣም የሚያበረታታ ነው። ይህንን ያህል የሕክምና እጩ ተማሪዎች፣ እጩ ዶክተሮች እዚህ በመካከላችን ተገኝተው ይህንን ማቅረብ መቻላቸው በጣም ትልቅ ለሁላችንም ደስታን የሚፈጥር ነው እና በጣም እናመሰግናለን። Thank you very much. Now we are going to the question and answer time. So we have the experts, Dr. Kale and Dr. Beti amongst us. So if you have any questions based on the presented issues or anything that is like disturbing you or worrying you, you can present it and then they'll be able to answer your questions. So now we'll go to the question and answer time. So please raise your questions now. Now, ጥያቄዎቻችሁ ማቅረብ ትችላላችሁ። በቀረቡት አርዕስቶች ላይ ብቻ ሳይሆን ሌሎችም የሚቆጠቁጧችሁ፣ የሚቆረቁሯችሁ፣ የሚያሳስቧችሁ ነገሮች ካሉ ጥያቄዎቻችሁን ማቅረብ ትችላላችሁ እና እሱን ዶክተር ቃልና ዶክተር ቤቲ ያስተናግዱልናል። ወደ ጥያቄዎቹ እንሄዳለን።
Thanks, and lunch is going to be next. Sina, I've seen your hand. You'll be the first person. I just wanted to say welcome to Dr. Betty. She is further along, and I said Sami is starting his residency in July. She's at the end of her surgical residency. She. Yep, you can give her a round of applause. Yeah. She's at U of T, and she's going to be traveling to Ottawa for what we call the Royal College exam. So once you pass that, you just sit down in front of a whole bunch of surgeons from across the country, and they ask you questions. It's like, you have this person that's been shot in the chest, is dying. What do you do? So you got to say, this is how I'm going to save him. This is the type of instrument I'm going to use to save them. This is what I'm going to ask the nurse to give me. And they're going to say, he's dying. What else are you going to do? So high pressure, high stakes. Betty's up to it. She'll be fine. But that's the point where she's at. And then she will join the ranks of the fellows of the Royal College of Surgeons of Canada. And she hasn't had enough. So she's actually been accepted to a 2-year surgical oncology program. So she's going to be here at U of T. Give her a round of applause. That's a really it's the surgical oncology program at U of T is one of the top programs in the world. So people come from all over the world to train here, basically to become cancer surgeons, right? So she's got 2 years ahead of her, but she's going to come out and probably treat me and you guys at some point. So if you don't see her, maybe it's a good thing. I don't know. But welcome, Betty, and she's in the midst of, actually, it's just in 2 months, right? In the midst of studying, getting ready for her exam, so we really appreciate her time. And please make sure you ask questions, take advantage of the expertise that we have in Dr. Betty as well. So, Senator, go ahead, please. Just you can pass this one.
የጡት ካንሰርን በተመለከተ ከላምፕ ሌላ ኤርሊ ስቴጅ የሚታወቅበት መንገድ አለ?
Yeah, tackle that.
So a lot of people will have skin changes on the breast.
So the question is, other than feeling a lump in the breast, is there any other way to find out if someone potentially may have breast cancer?
So I would say the two things are changes to the skin of the breast. It looks more like an orange, so you see the little dimples on the outside, or it's starting to turn red in a particular area and it doesn't go away. And if you start to feel lymph nodes, like little rubbery balls under your armpit, those can be some early signs that there is breast cancer that don't relate to a mass.
It could also be what we call nipple retraction. So there's a change when you compare it to the other side. The nipple seems like it's going in. For some people, naturally, that's the way it is. But if it's a change, a recent change, that's another reason to talk to your doctor and get a mammogram, which is an X-ray, but also get an ultrasound then of the breast. That's a good question, Senator. Thank you. Salah, go ahead.
Thank you so much, and congratulations, everyone. My name is Salah. The question is briefly raised with earlier person, my brother. I always wonder when there is a presentation about health-related. If we take an example of even EthioCan Bridge's presentation in the past years, in almost all the presentations, the Black communities are at high risk, like the highest susceptible population for those diseases, and it always makes me wonder why did the research done by Black people? I mean, are they part of the research team, or is there any research that's done recently that makes it more Black community? Is it a gene-related thing? Is it related to the food that we is it the lifestyle in general? If there is any insight about that, I really would appreciate to.
Yeah. Betty, you want to give it a try?
I have.
Salah, that's a great question.
I have a controversial kind of answer. There's a part that's true, and there's a part that's untrue when it comes to Black people having higher rates of things. A lot of the research is by Black people studying Black people, but of course there can be bias in things. But let's say there's no bias. There's a lot of data that shows African Americans, people in Africa, etc., have higher rates of cancer. Part of it is maybe some genetics. But a lot of it has to do with our experiences living in this society and how they impact us. So maybe because you're Black, you tell your doctor your symptom, they don't take it at face value, and then you get diagnosed at a later stage, even though you went to the hospital at the same time as anyone else. And it was bias or racism that delayed your care. Or because you're Black, you're more likely to be poor, so you don't have access to money, resources that's going to help you catch your disease early or treat it a bit better. It's not just that you're Black, it's that it puts you at risk for other negative kind of factors in your society, the socioeconomics of things. Only a small part of it is related to your actual genetics. The part that I feel like is a little bit my take is that a lot of the data about Black people puts us all in one category. I know a lot of Abisha people, they used to say, oh, like, I'm not Black, I'm golden or whatever. But we, normally identify as Black people now. But there is lots of data that shows the genes in West Africans versus South Africans versus East and Central Africans are very different.
And a lot of the data in America about Black people there is based off of West Africans. So even though there's more things like triple negative breast cancer, whatever, in Black people in general, a lot of that doesn't necessarily apply to East Africans. We just don't have a lot of data to prove that yet. We still have a lot of cancer in Ethiopia and Eritrea. It's just not documented well. Like in Addis, at their teaching hospitals, mainly people present with colorectal cancer actually. But we don't see it as a problem that we have because it's not as well known. People present late and there's lots and lots of underdiagnosis, particularly with cancers inside of the body. Instead of breast cancer, for example, which when it gets very advanced, people can see or feel. So we have a lot of cancer in our community that we just don't know about. To summarize, it's the factors outside of race that make you more susceptible to these cancers, I think.
I think that's very well put, Betty. So I think, a lot of scientists would subscribe to the theory that inflammation or swelling in our bodies puts at an increased risk of cancers and different diseases, heart disease, diabetes. We've heard about these things. How do you get inflammation in the body? Stress is a big one. You're stressed. There are hormones in your bloodstream that you can actually measure that tell you that your stress hormone is elevated. I find myself not too infrequently in the operating room in the middle of the night treating a young 20-something-year-old with a big hole in his stomach because he's super stressed out. Healthy, nothing wrong with him. He's got a huge hole in the stomach, he's dying. We've got to fix that. So we know that stress has a physical impact. So when we talk about mental health and mental well-being, in EthioCan, we're talking about all of us. How do we actually reduce that level of stress in our bodies, right? And reduce that inflammation in our body, reduce the chance of chronic disease, like cancers and diabetes. So, to come back to the socioeconomic environment that we, Black people in general, find ourselves, it is a stressful environment. You still have to navigate these things day in and day out. And that added stress most likely does contribute to some of these chronic diseases, not that we're intrinsically inheriting a bad DNA from people that have come before us. Yes, question.
When we were talking about sort of like diabetes and stroke and heart attack, and even like blood pressure, one of the top recommendations was to stay on top of it with your doctor and to go with your family doctor and go consistently. Obviously, statistically, 1 in 4 of us don't have a family doctor, including me. For those of us who don't have family doctors, what's kind of the best alternative to having medical professional able to help you through it? And a second question kind of related to what you just said. Obviously, stress is like a huge factor in health. We were like joking about it before. It's like, we just did like the blood pressure, and both of us were higher than we should be. How do you practically go about reducing stress, especially for those of us who have financial situations, jobs, all that sort of stuff, which just come with stress?
A great question. I didn't get your name. Leon? Thanks for the question. So, despite the fact that I'm not a family physician, I think I can answer some of these questions. And let me tackle the second question first. How do you reduce stress in your life? I think we've gotten to a point in society where we accept stress as being, hey, listen, like who's not stressed, right? Like so, the body doesn't know that. Stress is stress for the body. We're still gonna suffer the consequences, right? So, one of the more important things to do is mindfulness exercises. So it could be as simple as breathing exercise, right? Like find 20 minutes, half an hour in your day where you just sit and listen to yourself breathe, right? That's kind of a simple exercise. But some of these mindfulness exercises have been shown to reduce that stress hormone in your body if done consistently. Obviously, like if you find yourself in a job where you have to make a living and this stressful environment, you can't change the environment, maybe changing the way you respond to things. Your boss shouting at you is to the body the same as a lion attacking you. That's the kind of response you get inside, right? But a lion is not attacking you, your boss is not going to eat you, right? But that's the kind of primitive response that's mobilized in the body. And people live in that type of environment day in and day out. And it's not a surprise that sometimes people end up with a whole bunch of autoimmune things and diabetes and heart attack, right? So, how do we respond to the environment? If you can't remove yourself, then, doing some of these ancillary things, mindfulness exercise, take a break, take time off as needed. So that's kind of a simplistic way of looking at it, but we have to do something, right? You can't just continue the same way and expect a different result. The end result is the same. We all kind of die from stress-related problems, right? I don't know if you want to tackle the first question, if you don't have a family doctor. Okay.
Healthcare Connect, that's how I found my family doctor when I came back to Canada.
Healthcare Connect, okay.
You sign up online, your postal code, they'll email you back eventually with a nurse practitioner or a family doctor. And they were taking too long, so I just kept calling them, and then they gave me a provider on the phone.
Yeah, I mean, it's a chronic issue in the healthcare system. The ability to get a family doctor or primary care physician has been there for decades. It may be changing. The way I see it, there's a lot of talk about AI, how it's impacting a lot of disciplines. The biggest problem for family doctors has been, paperwork, right? Like, they see a patient and then they have to spend time documenting. Now, there are systems that are coming on board. A lot of us use it where I can sit and talk to my patient. I can look my patient in the eye and we discuss things. And at the end of it, there's a note that's already made just from an ambient conversation capture. So some of these things may lighten the load, make it more likely there's less burnout. Family doctors are more likely to take on more patients. And then more trainees coming through the pipeline as well. Until that happens, I think walk-in clinics and Healthcare Connect, we're going to have to navigate somehow. Okay. Any other questions? Yes, Anna, go ahead.
I have a question specifically about colorectal cancer. Lately in the media, we've been seeing that younger patients are presenting with this cancer. We're also learning about more carcinogens like processed meat, for example, that's kind of being flagged by Health Canada. And for various things that you mentioned, our culture, we have like rich vegan foods, fast, and also being Black, there's higher rates of poverty, so you might not be able to kind of get the organic foods or get that gym membership, which could significantly lower your risk. So sometimes it can feel helpless in terms of lowering your risk. So I guess are there things in the OR that you guys are seeing that maybe are putting people at higher risk that we on the ground don't see? And do you think that the screening guidelines moving forward will change to kind of reflect the patterns that we're seeing now with younger patients?
Go ahead, Ben.
So screening guidelines right now, if you're 50, you can start doing stool-based testing. If you're higher risk or you have a family history, you can start younger and with colonoscopies. I was involved in a group that makes me believe that they're going to lower the screening age to at least 45, maybe 40. That being said, if you're less than 50 and you have symptoms, you take those symptoms to your family doctor or the emergency department if you don't have a family doctor, and you can get a referral for a colonoscopy. You have to advocate for yourself. If something is wrong, in particular, there's blood in your stool, you're having constipation or the caliber changes, or you're really feeling unwell. Things that people can look out for, honestly, there are lots of carcinogens. I don't think that we have a clear pinpoint cause, so I don't want to say avoid this one thing and you're going to be good. But yes, processed meats, processed bread, which is the normal kind of bread most people buy from the grocery store, all the processed food that we eat in general, smoking, vaping, all those things can put you at increased risk. So I would say you try and live a good lifestyle as best as you can, but more so if you're young, know what's abnormal and what symptoms are concerning and advocate to get a colonoscopy. Don't let somebody just tell you it's hemorrhoids without, checking on things further.
Yeah, I think just to add to that, there's certain things that are more common, just as, you have a vegan spread here. It looks fantastic. I gotta give props to this and her team for putting it together. healthy food. But we eat meat a lot, I think, as a group. I think if I can generalize. Red meat, there are a lot of studies, kind of association studies that say red meat is probably not good for you, as far as specifically colon or colorectal cancer is concerned. And barbecue meat, I eat barbecue meat. I try to limit it, but again, kind of burnt meat is not good for us. It creates supposedly carcinogens on the surface that could be harmful. But beyond that, I mean, when you look at the colon cancer incidence, so like who's getting colon cancer in 2026?
If you trend the past 20 years, the rate of colon cancer for the people that are screened, which is 50 to 74 or 75, has been declining. The rate of colon cancer in the 30 to 50 group has been going up. So that is a concerning trend, and that's what's prompting this push to screen people early. Why are we waiting until 50 to do a colonoscopy? Why shouldn't we do it? In the US, it's already down to 45, but most likely 40, based on the fact that that group is having an increase in the incidence, 40 is probably going to be the new norm. As to what's driving it, really tough to say. Yeah, less stress, eat well.
Good question, Doctor.
Yeah, it's a really good question. Yes, go ahead.
Thank you very much for all great presentations. Thank you all for all the great presentations. My question is, in almost all the slides, age ranges were given, and I don't know whether it's intentional or the policy, the system, it's all either cut off at 70 or only one slide had 74. What happened to all those? The life expectancy is rising, and what are you suggesting to? Why don't you just put the upper limit indefinite? Thank you.
Very good question. Go ahead.
So yes, you're right. A lot of the screening, they have a cutoff, and it's based on
not that long ago, but times where the overall life expectancy is lower. But most family doctors will still recommend you get these screening tests if, number one, you have symptoms, and if you're fit enough. Like, really, this is what they think, if you're going to be alive in 5 or 10 years. Because if you're very frail or you have a lot of medical issues, the idea would be that screening and stopping one disease might not stop the others. So that's what their thought process is. But we see people in their 80s get colonoscopies. We see women in their 80s get mammograms. Pap smears less so. Prostate cancer screening, yes. So even though that's just what it says, because that's from the government, you're still eligible to get all of these screening tests done if you're fit and, can withstand the test itself.
Yeah, it just means that, if you're in that age group, the government is sending you, like Cancer Care Ontario, for example, is sending you a letter reminding you got to get your colonoscopy,
you got to get your stool test done. If you're outside of that age band, like 50-74 for colorectal, you can, like Betty said, you can still, depending on where you are, some people are high risk, they're in blood thinners, say they shouldn't have procedures, and there are a lot of extenuating factors for which they may say, maybe colonoscopy is not for me. So it becomes like an individual decision making with your family doctor, but the screening shouldn't stop. If you're enjoying a good, healthy lifestyle into your 80s and 90s, which we supposedly were approaching with longevity studies suggesting that you should continue to get checked and maintain your health and not kind of treat a disease, if you will. Yeah. So we've entertained a lot of questions. I know the food is ready. We're happy to take more questions. This is the most important part of the day, where you guys can ask, get things off your chest that have been bothering you, or ask important questions. And there have been great questions as well. And as you're thinking about that, if no additional questions, our initial kind of lunchtime setting time, do you have a limited time on one more question, and then we still have 1 hour? 1 hour for lunch, okay? Okay, good. What's the question? Go ahead.
Take one more question.
Okay.
And then we're going to come here for the Tuesday and then to lunch.
Perfect. Okay, so there's this is the healthiest part of my week, I think. There's juicing happening, like if you guys have been here before, they've done it for us before. They're fantastic, yummy, like there's ginger, lemon, everything that's good. And then there's lunch. And then after, in the afternoon, we have the featured film that's happening second floor, just out to the red door on the left, one flight up. And you can take elevator side, I believe. And that's really kind of the EthioCan mental health portion of the day. It's going to be really fantastic, engaging panel discussion after the movie. Hopefully you'll stick around and join us for that as well. Okay? One more question. Or Betty, go ahead.
I was going to do one more shout out. One of our other graduating medical students here is going to be an anesthesiologist.
I beat you to it.
Okay, sorry. I just want to make sure.
Another round of applause, please. Yes.
I was late.
It's all good. You're going to internal as well? Oh, congrats, yes. Very good. So I think we'll just carry on to the juicing station, which is where Sede and Senator are standing. You guys can see it. And thanks again for sacrificing your Saturday and joining us at EthioCan and Taibu. Okay, thank you.
ዶክተር ቃልና ዶክተር ቤቲን በጣም እናመሰግናለን። አንድ ጊዜ ሞቅ ያለ ጆዋን አድርጋችሁ በዚህ በምሳው ጊዜ የምናደርገው መጀመሪያ ጁሱን ስለ ጁስ እንማራለን። ስለ ጠቃሚ ጁስ ስለ አሰራሩ እንማራለን። ናዛ እህታችን ከቺክ አስተምረናለች። ባለፈው ጊዜ እንዲሁ መታ አስተምረናለች እና ጁሱን ሲሰራ ታያላችሁ፣ ትቀምሳላችሁ፣ ቤታችሁ እንዴት እንደምትሰሩ ደግሞ ትለማመዳላችሁ ማለት ነው። ከዛ ሌላ ስክሪኒንግ ስቴሽን እየሄዳችሁ መጠቀም ትችላላችሁ። ስክሪን መደረግ ለደም ግፊት፣ ለስኳር መጠን መለካት ትችላላችሁ። ማሳጅ መደረግ ትችላላችሁ። 201 አይደለም 201 ቶዋን ላይ ቶዋን አለ። እዛ ሄዳችሁ ሰውነታችሁን መታሸት ትችላላችሁ። ዘና ማለት ፈታ ማለት እና ለሚቀጥለው ለኃይሌ ገብረስላሴ ኢንዲዩራንስ ፊልም እሱን ለማየት ትንሽ ፈታ ማለት አለባችሁ እና እዛ ሄዳችሁ ትንሽ ተነካክታችሁ ትመጣላችሁ ማለት ነው። ሌላው ምንድነው የኮሚኒቲ ሰርቬይ ቅድም የተባለው ሪሰርች እየተካሄደ ስለሆነ ጥቅሙ ለራሳችን ስለሆነ ስለ እናንተ የሚሰማችሁ እንድትናገሩ ሰርቬይ ይደረጋልና ለዛ መልስ ትሰጣላችሁ። ፎርሞች አሉ። ኪውአር ኮዱን በመንካት ደግሞ ተከታታይ ስለሆነ ዛሬ ብቻ አይደለም ሰሞኑንም ያደረጋችሁ ድርሻችሁ እንድትወጡ ለሌሎችም ላልሰሙት እንድታደርሱ ጥሪ እናደርጋለን። ሌላው ምንድነው ኔትወርኪንግ። እዚህ በኢትዮካን ብሪጅ ከተገናኛችሁ የኮሚኒቲ ግንኙነት ነው። እርስ በርሳችን ድልድይ መስራት አለብን እና እርስ በርሳችን ግንኙነታችንን ማዳበር አለብን እና እሱን ታደርጋላችሁ። ምሳ እየበላችሁ የጣፈጠ ምሳ ነው። በመቅዲ አገልግል ባልትና የተዘጋጀ ቬጂቴሪያን ምግብ ነው እና እሱን እየበላችሁ እንግዲህ ጁሳችሁን ተቀመሳችሁ በኋላ እሱን ታደርጋላችሁ። ቡናም አለ፣ ባህላዊ ቡና አለ። በኋላ እሱን ይኖረናል። ሌላው ምንድነው እዚህ ላይ እንደምታዩት ኢትዮጵያንስ ኢን ካናዳ ቢንግ ፉሊ ካውንትድ ይላል። ይሄ ምንድነው ሴንሰስ በሚመጣበት ጊዜ በካናዳ ህዝብ ቆጠራ ጊዜ ራሳችንን አናስቆጥር። ምን እንደሚያስፈራ አላውቅም፣ ግን ብዙውን ጊዜ የማይገባ እና መሰረት የሌለው አባባል ይባላል እና ምንም የሚያሰጋ ነገር የለም። ቆጠራ በቆጠራ ውስጥ መቆጠር ጥቅሙ ለራሳችን ነው። ለማህበረሰብ ለኮሚኒቲ ጥንካሬያችንን ያሳያል። ብዛት ጥንካሬ ነው፣ ቁጥር ጥንካሬ ነው። ስለዚህ አሁን አንድ ኤምፒፒ ጠርታችሁ እዚህ ብትጠይቁ ስንት ኢትዮጵያ ያለ ብትሉት ምናልባት እንጃ ወይ 10 ሺህ ነው የሚላችሁ። ምክንያቱም አንታወቅም፣ በፍጹም እኛ ይመስለናል እንጂ አንታወቅም። አሁን በ2021 በተደረገው ቆጠራ 42545 ኢትዮጵያዊ ነው ያለው ይባላል። እኔ 50 ሺህ ኢትዮጵያዊ እንዳለ ማቀው ወደ ካናዳ ሳልመጣ ነው ከ25 ዓመት በፊት። ዛሬም ግን 50 ሺህ እንኳን አልሞላንም ነው የምንባለው እና ይሄ ትክክል አይደለም ለራሳችን። ስለዚህ ሴንሰስ ሲመጣ ሁላችንም መቆጠር አለብን። በሜይ 2026 ቆጠራ አለ። እዛ ላይ በመሳተፍ ራሳችንን ማስመዝገብና ማን እንደሆነ ማሳየት መቻል አለብን እባካችሁ። ስለዚህ ላልሰማ ሁሉ አሰሙ። ይሄ ያልተፈለገ ወሬ መቅረት አለበት እና በትክክለኛው በሳይንሳዊ መንገድ እየተራመድን እየተቆጠርን ፈንድ ለማግኘትም ራሳችንን ለማጠናከር ተሰሚነት ይኖረናል ቁጥር ሲኖረን እባካችሁ እና ላልሰሙት ሁሉ አሰሙ። ከዚህ በላይ ጭቅጭቃችሁ አልፈልግም። አሁን ወደ ጁስ እና ወደ ምሳ እንሄዳለን። እንግዲህ ከምሳ በኋላ እንገናኛለን። መልካም ጁስ፣ መልካም ምሳ፣ መልካም ምግብ፣ መልካም ውይይት፣ መልካም ጨዋታ ይሁንላችሁ። እናመሰግናለን።
Thanks so much.
Thank you.
You should be first in line for the juice. How's your timing? Are you okay? You can stick around?
Yeah.
Fantastic. Good.
Yeah. It's going perfectly.
But yeah, I don't know if I introduced my sister. This is Amson.
Oh, hi. Nice to meet you, both of you. How are you?
Good. Congratulations.
Thank you.
You're famous, so I don't need to introduce you.
Hi.
የሚቀጥለው ሳምንት እንትን አለ አናግራቸዋለሁ። ብዙ አዳዲስ ያ ሰጥቻለሁ።
Thank you.
ጊዜ አናግራቸዋለሁ።
ራሄል እናገኘዋለን። Sure. What's your name? Hanan. Hanan. Are you undergrad?
Yeah, I'm an undergrad. I'm at UFT. I was very interested in like what you're doing right now, because I'm like pre-med as well.
Yeah. What year are you in?
I'm in my first year, but I'm going to go to my master's.
Good for you.
Yeah.
Are you guys friends?
I know, we all know that sound. You see? Quickly everyone's heads turn. So just before lunch, we're going to do a quick workshop. Some of you I have met at the same event took place. So if you don't mind, if I can please ask you to sit, because there won't be enough space for everyone to come up here, and then we can't block the walkway with the fire hazard. So I'm going to talk loud.
ግን በብዛት የአውቶሚን የሚባሉት ሉፐስ የሚባል አለ። የታይፕ 2 ዳያቤቲስ ራሱ አውቶሚን ነው ተብሎ ነው የሚታሰበው። ከጊዜ በኋላ የሚመጡ እንዴት ነው የሚመጡት የሚለው ብዙም አሁን የኢንተስቲን የአንጀት ችግርም አለ ኢንፍላማቶሪ ባውል ዲዚዝ እሱም ራሱ አውቶሚን ነውና እንዴት ይመጣል የሚለው ገና የሚታወቅ ነገር አይደለም። ብዙ ሪሰርች አለ። አንዳንድ ጊዜ ቫይረስ ኢንፌክሽን ሲኖር ሰውነት ያንን ቫይረስ ለማውጣት ሲታገድ የኢሚዩን ሲስተም ሰውነታችንን ይጎዳዋል አብሮ እና ያ ጉዳት አያቆምም ይቀጥላል። እስካሁን ድረስ ተጠንቅቆ የሚታወቅ ነገር የለውም።
ለምሳሌ ጆይንት ፔን ነበረኝ ሰሞኑንና ቤት ሄጄ ምናምን ምናልባት ደግሞ ይችላል ምናምን ነገር
እንደዛ ብለውሽ ነበር? ኦኬ።
እና ምንድነው የሆነ ቴስትሽ የሆነ ፖዚቲቭ
ሩመቶይድ ፋክተር
ነው የሆነ ለአውቶሚዩን እንትንሽ እና በደንብ ሊያስረዳኝ አልቻለም።
አሉ እንደዚህ የተወሰኑ
የሆነ ቴስትሽ ብቻ ፖዚቲቭ ነገር የሆነ ሊያሳይ ነው እንደዛ ነገር ነው ምናምን ስላለኝ ነው የጠየኩት።
አሁን እሱም እንደ ሩመቶይድ አርትራይተስ እንደ አውቶሚዩን ነው። ከጊዜ በኋላ ሊመጣ ይችላል for sure. in fact እንደ
After you get your lunch, you can come back and collect your juice. Is that all right with everyone? Unless you decide this is lunch and then, we leave that alone. But all the aunties have worked very hard. I appreciate you so much.
I didn't you? Do I still? I need both? Oh, I thought I was getting rid of this. That's okay. Okay, so the first one we're going to do is really lovely to enjoy in the morning. This one is DJ Biggie. I'm wondering why he's smiling at me. I haven't seen the brother in a long time. Okay, here we go. So this one is really great to have on an empty stomach because this one is really good in cleansing your kidneys as well as your liver. So we put our bodies through a lot of processed foods, as some of the doctors were speaking about earlier. And in doing so, our body builds up a lot of, again, dis-ease, which will linger. But having certain types of juices will help to detox and cleanse the body. We good? Awesome. So we're going to start with, and I've just cut up a whole bunch of vegetables here. Most of the stuff comes from the farmer's market that we work at, which is at Witchwood Barns, so it's organic. So what I've done is you'll see that carrots still have the skin on it. All I did is wash it. And the taste, incredible. I have some fresh parsley, fresh mint, fresh spinach. I'd like to say fresh mango, but we don't grow it here. Some cold mango, the same with pineapple. I have some celery, cucumbers, ginger. green apple. This is local Canadian right here. Organic beets, the same. Ginger, lemon, lime, bananas, and we have sea moss. So some of you may have heard about sea moss. I'm going to show you how we're going to use it, and we'll talk more about its benefit, okay? So we're going to start with the morning detox juice/smoothie. That consists of ginger, anti-inflammatory, anti-inflammatory, and anti-microbe. My doctors? Thank you. We're in the Habesha community. We fill in for each other, okay? Now, I'm going to put in, I'm just going to put this mic down for a minute if you don't mind. And if you can't hear me, let me know. Samuni? You can hear me? Okay. So, it's much easier to get your hands dirty when you're sharing than it is to hold on to a mic. So what I'm going to do, so I have, you see 2 big pieces of ginger, and it's great for helping to break down.
I help you.
Yeah? Okay. Thank you. Oh, right here. I think your daughter did this for me the last time. That's too funny. All right, so with ginger, it helps you out. Like I said, it helps, you know when you feel upset, like your stomach doesn't feel so good in the morning, especially if you ate heavy the night before? Even boiling ginger in hot water is fantastic. The ginger is organic. I still have the skin on, but if you wanted to move the skin, you just use a little spoon and scrape. It works fantastic. So I have 2 big pieces, cucumber, celery, ginger.
We're going to do a bit of lemon. And what I did with the lemon, my lemon is not organic, unfortunately. Otherwise, if it was, I would have kept the skin off. A lot of nutrients in the skin. But so I'm going to do 1 lemon. We're going to do some mint, because mint is fantastic with helping aid in digestion as well. And fantastic to just drink. Put a whole thing on hot water. That's the classic mint tea. Okay? Oops, let me save it. All right, so we got that. We're going to do a little bit of parsley. It's like salata in a blender. Okay, and then we're going to do some pineapple. So the pineapple also helps in aids in digestion.
Okay. Voila. So now, all we're going to do is add some water. If you want, you can add turmeric to this, black pepper, neshte berbere or cayenne. The other thing you can also do with this, you can add the sea moss. Sea moss has 99 out of the 109 minerals and vitamins that our body needs. So it's usually dry. It's like an algae. It comes from the sea. Like when you go Batza or anywhere, you see the stuff that comes on, that clings onto your leg, that you kind of shake off and are scared of. This is somewhat that is. We just soaked it, blended it, you add it. It doesn't have any taste, but incredible. Great for clearing skin, energy, sleep. It aids in so much. All right, and then all we're going to do is my favorite thing. We're just going to blend. All right, it gets a little noisy if you have babies. And this is therapeutic within itself. Like, this is so lovely. Now, you can add spinach if you want. We can add a little bit water. Just depends how thick or thin you want it. And you notice the color? That's how you know it's nutritious. Hello. Okay. It'll stop once it's done. So, and I'll show you the consistency. Okay. Now, with this juice, it's a juice made in a blender. Now, with juicing traditionally, especially if it's cold pressed, it kind of removes the fiber away from it. With this, you have the fiber. The fiber is what's causing a lot of issues with colon and colon cancers, because not enough fiber in the diet. Lots of carbs, but not enough fiber, not enough fruit, vegetables, whole grains, seeds, nuts. Okay? So sometimes what people like to do is strain this. You can strain it to make it a bit thinner like a juice, but you can just have it like so. All right, maybe we're gonna need one person to test this out for us. You want to try? Here, there you go.
I'm working too.
Okay, I'm gonna give you one anyways because you're the first one to run up. Okay, there you go. All right, so that's smoothie number 1. How is that?
Delicious.
What are we tasting?
Spicy.
Spicy. That's from the ginger. So because ginger, let's get his face. He's like, because we like sweet stuff. Habesha, we love our sweet, you know. But the reason this is this type of element because it really does help to detoxify. You can also add arugula if you wanted, which is ginger, or you can add kale. You can totally do this. I think what I'll do, I'm gonna pour it into a bowl. Yeah, let's do that. But also ginger. Sorry, Mara. So what ginger also does is, like I said earlier, it aids in digestion, but also anti-inflammatory. If you notice things like you bruise, your face puffs up, your body puffs up, it's inflamed, which is right now the biggest problem, with our digestive system, okay? Full of nutrients. Inky, sorry, here you go, honey. You can use this, yeah. Okay, so next I'm gonna move into this one. Yeah, this one will be a little bit refresher and a big zinger. So this one will conclude of mango, pineapple, banana, mint, what's this green thing again? Spinach? Spinach, yeah.
Exactly, spinach. We're going to use some spirulina. Again, this is also from the ocean. Packed with lots of protein, but also fabulous fiber, as long as calcium, as well as iron. Okay? And again, you see what we're adding? Water, that's it. Forgive me, I speak to Gina, so I'm going back and forth, but I think you can catch on. Okay. So let's do that. So we're going to add pineapple. Now to this smoothie, if you wanted, you can add like more protein. If you wanted protein powder or like pumpkin seeds, ground pumpkin seeds are fantastic. Okay. You can add nuts if you wanted, like cashews, almond butter, or cocoa, like pure cocoa. Okay. Or flax, exactly. We say that at telva. Okay. I'm gonna add some limes. Now, lemon and lime, they're both considered alkaline, which means it helps to balance our bodies. Our body should be at 7. Our pH balance should be at 7. Most people are more acidic, and when we are we
have too much acidity in our body, that's where the disease grows. So you try to keep it balanced. A great way is your water, put some lemon or lime slices, a little bit of ginger if you want, a little bit of mint, it goes a long way, okay? So I'm going to put 3 pieces of lime, and then what we're going to do is, I'm going to add some spinach. So for those of you who may not like your greens unless it looks like hamli or gomen, well cooked down, this is a great way to make sure that you're receiving all the nutrients. Because when we cook something too much, which we do as Africans, period, it loses some of its nutrients, okay? All right. And don't be shy, just put lots of spinach. Okay? Then we're going to add some more of our sea moss. Boom. Okay? Then we're going to add some spirulina. A little goes a long way. Yeah, I have. Yeah, you can switch, and then I have more here. Okay? Then we're going to add, what are we missing? Banana. Mousse. Okay. And how do you say mousse? Okay. We say banana in Tigrina. Weird.
No Italian?
No, I know Italian, English. All right. So we're just going to put a couple of bananas. But what I want to emphasize is the fact that we're not adding artificial sugar of any kind. I went to buy a juice at the market earlier today. I was leaving. I said, I need juice. I said, what flavors do you have? They showed me their flavors. What do you think was in it? Sugar. Why? Why? So here we go. Hello. So mango, banana, pineapple, spirulina, sea moss, spinach, And I'm going to leave mint out for this for now. Actually, no, let's do the mint. And you can put the whole mint in because there's lots of flavor in here. All right. We can use it here, honey. She's going to rinse it? Okay, thank you. All right, so here we go. And you can do this in the morning before you go to work, before you go to school, or when you come home, or when you're hungry. It's a great way to just eat healthier instead of going for those chips. Look at the color now. You can add ginger as well if you want, but I want to give you different flavors. It's so much darker. The darker, the better. Again, you can use, I know the darker, the better. It's like the berries, you know? The darker the juice. There we go. But you'll see how dark that is and thicker. You can make it thicker with less liquid. You can also use milk if you want, whatever milk you like. But, so that's number 2. So for this one, we're just going to do a quick rinse because we need this color to show up. That's next, okay? Give me 2 seconds. So think of questions that you want to ask.
Girlfriend? They were married? Huh? You have a boyfriend?
Mara, we can get more water too. Let me get more water.
In English, we say beets, okay? This is the natural lipstick.
And then we have some apples. Again, local apples. I have, you see how big this ginger is? Fantastic and organic. Be very careful where you're getting your ginger from and where it is from. If it says from China, leave it alone. Okay, so apples. Now it may look like, oh, carrots are sweet, apples sweet, beets sweet, that's too much sugar, but it will all balance up. And this particular one is really, I love this one for the ladies because it's full of iron. Because you know most women, especially women of color, we are iron deficient or have very low iron. So, and to help the iron, for it to be absorbed by your body, you need vitamin C. So we're going to do the lemon and the lime. So this one will have a bit of zinc. And then we're going to add, sorry, my parsley. You can also add orange, fresh orange slices in here. We're going to add the parsley and water. If you wanted to, you could add the sea moss again, but I think I got you sea mossed out for a moment. So we'll do this one without the sea moss. But do you see how quickly? They don't take much time. All you have to do is your prep you could do ahead of time, you could do the night before, peeling, cutting. The apple, leave it until the moment that you're about to blend it to cut it so that it doesn't oxidize and get brown on you. Okay. This መጨረሻ ላይ personality. Okay. To build more muscle that way. Decorated.
So this juice also works well if you do strain it, but you can enjoy it just as it is as well. But what we don't do if you strain it, do not throw away the pulp. You can use the pulp to make wraps or you add it in your soup.
Don't throw it away. Or you can make cakes with it if you like. You can do so many different things. Okay, ready? That's good? Yeah. Look at this color.
Wow, look at that.
It's so rich. And you can eat beets raw. That's the wonderful thing. I love to just grate them and eat them. Or you can even put them in your, cook them in your oven with some sweet potatoes, regular potatoes, just a mix of veggies. So we're gonna add a bit more water. Okay. It's a bit thicker. Nishte, just a bit for that one. Yeah, because it's rich. It's, yeah. Okay. And then we'll be done. Thank you so much. Yeah. Good? Yes, thank you. So, some of you have tried some of the juices that are coming around. Are these juices one that you would try? If it's a no, just stay quiet. If it's a yes, you say ililil. Are these juices that you would try at home?
Yes.
Okay. Wait a minute. Are these juices you would try at home?
Yes.
All right. You're really fantastic with that. So it's just a really quick pre-lunch juicing, but drinking these vegetables, consuming them in this way, ensures that you get more vegetables in your body, less sugar, which is carbs, which is pasta, which is ruse, which is, injera, as much as we love injera. It's good to offset it from time to time with these type of things. And if you do them regularly, it would really help to kind of take care of your body and nourish it, especially the kidney and liver cleanse. That's really important. But then also with the mango, the banana, and the pineapple, and the veggies, more fiber as well as more vitamin C. So these are simple things we could do. And summer's coming up. So get your fresh mangoes, get your fresh berries. You can freeze them if you need to. But different ways to consume and kind of go from there. Do you have any questions for me? Any questions? You're ready for lunch, Mish? Okay. Thank you so much to the organizers. So happy to be with you again. And come and visit us. We have a bit of a restaurant for a few months up in Eglinton and Oakwood. We're doing a pop-up inside of Masala restaurant. So you can come and get some of our delicious vegan food, okay? Tamasgan. Thank you. Thank you, my dear.
It's chickpea.
Chickpeas veg, yes. Oakwood and Eglinton, yeah. And I have the QR code, 1610 Eglinton. Thank you.
Okay, a big applause to NASA.
Yeah. Thank you.
እና ሬስቶራንት አላት አሁን የተከፈተ ኦክውድና ኤግሊንተን ላይ ነው። እና እንግዲህ በጣም ቆንጆ ጭፎች ነው የምታዘጋጀው፣ በጣም ጣፋጭ የሆኑ እና ትንሽ የሚቆጠሩ ጭምር ለጤና ምናልባታችን አስቸጋሪ ሆኖ ሊሆን ይችላል ስላለመድነው ነው የስያሬ መመደ እና በጣም እናመሰግናታለን። እንግዲህ ጤናችንን ለመገንባት የአንድ ጊዜ ሞቅ አድርጉላት። እሺ ቴንኪው በጣም። አሁን እንግዲህ ወደ ምሳ ነው የምንሄደው። ምሳችንን በላበላ አድርገን ወደ ቀጥሎ ፕሮግራም እንመለሳለን።
So we don't bug them. You'd like a banana? You're welcome, buddy. Yeah, thank you. Just let me.
Okay, we have to leave this table down.
Yeah. Just, I gotta wipe it down. Sorry, Mahare. We're gonna move the table. Before I go. Yes, please. Thank you. You want to take this? You can put it on top. Oh, what? Yeah. Thank you.
ሰውቀው ገብቻለሁ ዘመድ ሲመክረኝ ቶሮንቶ ታምሜ ሞት አዲስ አበባ ቶሮንቶ ታምሜ ሞት አዲስ አበባ ትዝታ መቃብሬን ያርጓታ ትዝታ መቃብሬን ያርጓታ ቄሱም ይመለሱ ጽናት ይዘው ዳዊቱም ይታጠፍ ፀሐይ አይምታው ፍቅር ለገደለው ፍታት አለው ፍቅር ለገደለው ፍታት አለው ትዝታ ለጎዳው ፍታት አለው የኔን ነገር ላንቺ የሚያመላልሰው ያንቺን ነገር ለኔ የሚያመላልሰው ብዙ ሱሱን የለበሰው አንዱን አካል ፍቅር መለየት ገንጥሎት አለው በግማሹ ደስታን አዝንጥሎት በደስታ ሐዘን በሳቅ ፈንታ ለቅሶ የነበረው ፍቅር በእንባ ተለውሶ ማሪኝ ብዬሻለው እሞትብሻለው ማሪኝ ብዬሻለው እሞትብሻለው ቆዳዬም ተገፍ ይሁንልሽ ጫማ አጥንቴም ይደገም ላንቺ ከተስማማ አጥንቴም ይብረደው ራቁቴን ልሂድ ካንቺ የበለጠ አላገኝም ዘመድ ማሪኝ ብዬሻለው እሞትብሻለው ማሪኝ ብዬሻለው እሞትብሻለው ሰው ሆኖ ስህተት የማይሰራ የለም የአንድ ቀን ጥፋቴ ነይ ማሪኝ የለም ማሪኝ ብዬሻለው እሞትብሻለው ያሳራድኛል
ይገርማል ስትሄድ ስከተላት በጎን ያየችኝ አማላጅ ጨክና ያለችኝ ተሞኘው ደግነሽ ያልኩኝ ባንቺ ላይ ስመካ አንጀቴን ትቆርጪ ጨካኝ ስትለካ ፍቅርን ለብቻዬ ወጣብኝ ምናልባት እድሜዬን ገፋሁት ስትሄድ ስከተላት ስትሄድ ስከተላት አስታውሽ ኧረ ምን በደልኩሽ እባክሽ ከሄድሽ ወዲያ ከዚህ ፊት እኔ ጋር ተነሺ እንዲሳው ይሰበር የኔ ፍቅር ካንቺ ያየልኮ ነበር ትዝታ ወይ ባቲ አንቺ ሆይ የማይደል የልቤ ቅኝቱ ተኝቷል ካምባሰል ደሴ ገባውዬ መሸብኝ ደሴ ገባውዬ ኮምቦልቻ መሸብኝ እተውሻለሁ ስል ደግሞ አገረሸብኝ ቦርከና ሞላብኝ ቄጤማው ድረስ ቦርከና ሞላብኝ ቄጤማው ድረስ ሰው ናፋቂው ልቤ እንዳይ አደራ ቢሰጡት ይበላሉ ይገመድ አደራ ቢሰጡት ይበላሉ ዘመድ ያው ዘመድ ይሻላል ባዳና ወረሽ ምንም ቢሆን አበሻ ይሻላል አይደል? ሀገሬ ልጆች ቴንኪ ከፋም ለማም ያበሻ ልጅ ይሻላል። የኢትዮጵያ ልጅ ያበሻ ልጅ የኤርትራ ልጅ አደራ ቢሰጡት ይበላሉ ዘመን እንግዲህ ሀገራችን እግዚአብሔር ያስተካክል።